think you have this mixed up. I'm James. I'm calling in to call me, and you have me unmuted.
Okay. Your name, is this James Tubman? Oh, that's James Skank, is what you're saying.
Yes, ma'am.
How strange. It has you listed as Herman Moore.
I'm praying for y'all all the time.
Well, we definitely need that. Do you want to see our invocation today, Mr. Skank?
Dear Heavenly Father, we just pause for a minute to just take advantage of the time of governing our city, helping our country. Bless all those that are falling ill from this virus and many other things. Help us figure new ways to progress into these problems that exist and find answers. Take care of all these folks that y'all are working so hard at trying to make things work. Blessings to all. Amen.
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 What a perfect and beautiful prayer. And I just want to say thank you so much, Mr. Skank, for being flexible and adaptable to step in and to fill that role for us today. You really blessed us. Thank you very, very much.
Totally unexpected, but thank you.
Yeah. We have two proclamations today on our agenda. The first one is for Emergency Nurses Week, and Councilwoman Frida Powell is going to lead us in that.
Yes, thank you, Mayor. I'm happy to do that. Whereas the nursing profession is one in which the mind, the hand, and the heart are devoted to the mental, physical, and social improvement. It is a profession devoted to tender care, restoration of health, and alleviation of suffering. And whereas emergency nurses are highly trained to recognize life-threatening problems and solve them on the spot, playing a vital role in treating patients in emergency situations, caring for those most in need, and saving lives on a daily basis. And whereas our community is extremely proud of our many nurses who continue to uphold the highest standards of a profession so essential in assuring our citizens the best in health care and treatment. Now, therefore, we, Mayor and City Council members of the City of Amarillo, Texas, do hereby proclaim the week of October the 11th through the 17th, 2020 as Emergency Nurses Week. In Amarillo, urging all citizens to join in this expression of appreciation for the highly skilled and efficient humanitarian service which our nurses provide. Given under our hands and seals of office this 13th day of October 2020, the Honorable Mayor Ginger Nelson, Council members Elaine Hayes, Frida Powell, Eddie Sauer, and Howard Smith.
Thank you, Councilwoman Powell. And I think we might have with us on the line Deborah Cassida from who could speak on behalf of Emergency Nurses Week. Maybe, maybe not. So far, I'm 0 for 1 on identifying people calling in to speak. I might be 0 for 2. Okay, I don't think we have her after all, but that's not a problem. We're still celebrating and so appreciate emergency nurses and nurses in general, especially during this trying time that we're in right now. We'll move to the next proclamation. Thank you, Councilwoman Powell, for leading us in that. The next one is Dyslexia Awareness Month, and we have Mayor Pro Tem Smith, who's going to lead that proclamation.
Thank you. Yes, this is Dyslexia Awareness Month, so I'm pleased to present this proclamation. Whereas dyslexia is one of the most common learning disabilities affecting Texans, and whereas this lifelong disorder can be a detriment to a child's education or an adult's professional development by inhibiting interpretation of spoken and written language. And whereas with a proper diagnosis, individuals can be taught appropriate, systematic, and structured methods of learning that enable them to excel in their school and work environments. And whereas it is vital to communicate the importance of early diagnosis, thereby providing assistance and guidance to those affected by dyslexia. Now, therefore, we, Mayor and City Council members of the City of Amarillo, Texas, do hereby proclaim October 2020 as Dyslexia Awareness Month to further raise awareness of this learning disability and encourage our citizens to learn more about dyslexia. We also recognize the dedication and understanding of family members, teachers, and other professionals who play a role in the success of these individuals. Given under our hands and seal of office this 13th day of October 2020, signed by Junior Nelson, Mayor, and Council members Elaine Hayes, Frida Powell, Eddie Sauer, and myself. And we have Dr. Michelle Simmons here, I think, wants to make some comments.
Yes, good afternoon and thank you. I'm Michelle Simmons, Lana Hatton Professor of Learning Disabilities and Director for the Center for Learning Disabilities at West Texas A&M University. On behalf of WT and the Center for Learning Disabilities, I would like to express a sincere appreciation for your taking the time today to recognize and increase the community's public awareness of dyslexia. As you already so well proclaimed, dyslexia impacts a significant number of children, teenagers, adults, and their families. And it is our aim at WT Center for Learning Disabilities to assist every child in the Amarillo area the opportunity to learn to read. So thank you for your time and consideration in this proclamation today.
Thank you, Michelle. Thank you for the work that you and the staff do at the WTAMU Center for Learning Disabilities. It's life-changing, not just for the kids and the adults involved, but for their families and the people that are part of this community. So we do appreciate the work that y'all do all year long, and we're happy to support bringing awareness to dyslexia. At this time, we'll move to the next item on our agenda, and that is announcements regarding new employees and promotions. Mr. City Manager.
I'm here and unmuted. All right, well, I wanted to take just a moment to introduce some new team members. They're very key positions. One, you all know, Andrew Freeman, historically our Director of Planning and Economic Development, has been promoted to a Managing Director over Development Services. And that is basically having 4 departments reporting to him. And the goal there is to make sure that we have one person coordinating all the efforts of these departments that rely upon each other to make sure that our development process is as efficient for our businesses and developers, but also efficiently takes care of all the, pardon me, I'm very sorry. One of the joys of Zoom. That also makes sure that we are addressing all of the requirements that we have in the development process with regard to ordinances and also state statutes. That includes building safety, planning, environmental service, environmental health, and fire marshal's office. All of those departments have a review and inspection role during the development process. And the goal of this is to make sure that these groups work as efficiently as possible together to the benefit of our applicants and people doing development inside the city of Amarillo. Floyd, do you have anything to add with regard to Andrew? Andrew reports to Floyd in this construct, and I want to make sure and recognize that Floyd Hartman, Assistant City Manager, has a key role in this process as well. Floyd?
Thank you, Jared, Mayor and Council. I'm excited to have Andrew in that role and look forward to his experience of bringing some consistency that we much need throughout that process. He'll work hand in hand with the other development services departments as well, capital projects and those. But we're really excited for Andrew's experience and what he brings to the table in this.
Now, the other, we have 2 other ones that we need to introduce, and I'm gonna say a little bit about these 2 people, and then I'm gonna throw them to their respective assistant city manager or deputy city manager to give some details. Andrew, did you have anything to add? I don't want to jump on before I give you a chance to say hi to everyone and for them to recognize you for this opportunity.
No, sir. I just appreciate the opportunity. Over the last couple of months, I think it's already paying dividends being able to collaborate and work with the other directors in those departments. So just looking forward to it.
All right. The next one is our Director of Community Development, previously filled by Juliana Kitten. Pardon me. Somebody leaves and I immediately forget their name. No, by Juliana Kitten, who did a wonderful job for us in community development, working with our homeless populations, our at-risk populations, our low and moderate income populations, and all of the other citizens that fall into the service realm of the community development department. She did a great job. And one of the things that she also did is basically almost train up her successor. Jason Riddlesberger, formerly Sergeant Jason Riddlesberger, has been working in this field his whole career and working very closely with Juliana during her entire tenure with the City of Amarillo. So I couldn't be more proud to announce Jason Riddlesberger and introduce Jason Riddlesberger to you as our new Director of Community Development. Kevin, do you have anything that you can add? I know that Jason has an impressive resume as far as working in this area throughout his entire career with the police department, and I think he's going to translate very effectively, immediately into community development. So, Kevin?
Yeah, thank you, Jared. I couldn't be more excited about the opportunity to promote Sergeant Riddlesberger from the Amarillo Police Department and him resigning his commission with the Amarillo Police Department and now accepting a role as the director of our Community Development Department. Me and Jason have had a number of opportunities over the last several years to work together on various projects addressing homelessness and those at most at risk and most in need in our community. And you won't find somebody who has a bigger heart for the homeless and for helping those in our community to find a path towards out of the crisis situation they're in and into a pathway of recovery and hopefully beyond. So couldn't be more excited and more proud of Jason Riddlesberger taking over the reins. He has very big shoes to fill. Juliana Kitten has done just a tremendous job over the last 2 years, reimagining that department and kind of bringing us in line with some of the very contemporary practices that HUD has been moving forward in our Coming Home program, doing a housing first model, helping those that are homeless. And Jason has been working hand in hand with her to get those projects off the ground and working very closely with her to do those things. So we're just in a great position to have just an outstanding leader taking over that department. And I know Jason will put his own mark on the department, but he's got a big heart, and his heart is in it to help those in need in our community. And we're very excited about his position as the permanent director of the department.
Jason, do you have any comments?
I do. I just want to thank you all for the opportunity, and I'm so proud to be here. I've served the police department for 24 years, and I love Amarillo, and it's just such an honor to get to continue my role in serving the public and serving my community. And I'm just so proud to be here, and thank you for the opportunity, and I look forward to the future.
Right, and then our final edition, one that we've been waiting on for some time, and a process that took quite a while to do, is finding a replacement for Laura Storrs, who is now our assistant city manager and assistant city manager, but previously was our director of finance. She served with the city for a long time and is doing a great job as assistant city manager. But one of her job ones was to get that director of finance role filled, because she's been wearing both hats for a good number of months. So we're real excited to introduce our new director of finance, Debbie Reed. She brings a ton of experience in exactly this same role. She was the director of finance with the city of Mesquite, and I can't say enough positive things about the professionalism and class of that organization. They are one of the most professionally run cities in the state of Texas. One of my mentors was a former assistant city manager there, and I know that I have cherry-picked from that organization previously before by stealing some of their great employees that they're trained up to do it right. Debbie is a great example of that. Laura, do you have any comments you want to make about Debbie before we throw it her way?
Sure. Thank you, Jared. Yes, we have been anxiously awaiting Debbie Reed's beginning at our organization. She does come with so much experience. She's already hit the ground running. We actually borrowed her from new employee orientation today because she started on October 5th. So very, new to the organization, but again, as Jared mentioned, comes with great experience as a finance director and an accounting manager at the city of Mesquite. And previous to that, she worked at a city in Michigan as well. She's a CPA and has all of the skill sets that we are looking for, and know that she will continue a long legacy that we have here in Amarillo of strong financial management. And so with that, Jared, I'll turn it over to Debbie. I actually, as I said, I called her in from new employee orientation for this. So she is socially distanced across the room. So I'm just going to trade places with her real quick.
Hello, Mayor and members of council. I'm so excited to join the Amarillo team and really appreciate the opportunity. I'm most excited to be in the Panhandle and enjoy this part of the country. I've heard many positive things about Amarillo already, and just really thrilled to join this team.
I just wanted to add
Welcome,
also, and I just wanted to add also, one of our hallmarks historically at the city of Amarillo has been strong financial management from our city manager's office and from our finance offices. And Debbie has the seasoning, she has the experience, and is just a solid financial pro. Solid is the wrong word, an exceptional financial pro. So I'm really excited about this. This is a really good catch for us. And she has a good hook into the area. So she has family in the area. And so this is a great win-win for us and for Debbie.
Yes, thank you. Thank you.
All right, and that's all I have as far as new employees, but those are 3 big ads.
Thank you, Jared. Of course, we welcome Debbie, and we're excited to all meet her face-to-face and to work with her. The other 2, Andrew and Jason, we're very familiar with them and their performance, and I just commend you on finding a way to work them into our organization that gives them more responsibility, gives them the opportunity for more leadership, conveys to them the value that they have to the city organization. And so I think we're very pleased with those 2 positions and those 2 employees that are proven in their roles here, but now will have a larger impact and larger responsibilities. So those are all great moves. Good job. Now we'll move on to the public address portion of our agenda today. We do have one citizen I know who wants to participate in that, Mr. Skank. So if we can turn his microphone on, and as soon as he starts speaking, he'll have 3 minutes to comment on anything on the agenda that he wants council to hear his thoughts on.
I just got unmuted. I've been praying the whole time.
Thanks,
Good afternoon.
James. We appreciate that.
Listen, you know, I was reasonably encouraged this week or just yesterday in understanding that we've been counting some of the hospitalizations ratios wrong, and was getting nervous at the fact that we were going up around 18%, and that there was all going to be some other lockdowns or shutdowns and stuff. And I'm encouraged to find out that Joe had been wrong about the counting, and that we're down to 10%, so that this curve that we're trying to flatten, which has been flattened, is flattened. So my encouragement is to, I know you guys can push hard. I've sent the governor messages to open up and get things running. There's too many businesses around here with still closed doors that you can't survive like that. Moving on to the next thing, for some reason, we're still concerned about a Confederate statue over in Elwood Park. It's amazing to me that up in Portland, they just tore down, these rebels tore down Roosevelt and Lincoln. We can't be that kind. We've got to leave things alone. Quit having knee-jerk responses to this anarchy. And one last thing is, today's the first day of voting. Get out and do that. And my suggestion is I vote no against the Prop A, B, and C. Thank you, Council. Y'all take the rest of the day off with pay.
All right, moving on to agenda item 1A. The first is to review your packet for anything that you had questions about right off the bat. Council, any questions out of your packet? Okay, moving on to item 1B is a coronavirus update. Mr. City Manager.
All right, Mayor, we're going to have quite a bit of information to talk about today. We have Casey Stoughton, our Director of Public Health, to walk us through the first section of it. That's going to be what's going on with coronavirus right now, and also talking about some updated forms and other things that can help our citizens track what's going on in our community and how it's affecting us. Some of that has to do with the formula that the governor had directed us to use last week and now has been revised. So we are still using the formulas that we were directed by the governor to use on these forms, and we want to talk about that. We also want to talk about our local experience, how that's different from our trauma service area experience. So there are some differences there. Our trauma service area is a 25-county area. We're a 2-county area. So we definitely want to make sure that guidance we're giving the citizens reflects both what the governor is grading us on with regard to our hospitalization rate, but also the 2-county experience, which is really what's going to affect how we live our lives. So she's going to do that. I'm going to go over the executive order GA 32, which is the most recent executive order from the governor, and then we're going to answer any questions council might have. Casey.
Okay, so we do have several items to cover today. Generally, my statement is about maybe half a page. I've got about 3 pages worth of information today. So I'll talk about everything, and then like Jared said, we can certainly take questions. But I'll first talk about the numbers, and then we'll go into some of the changes that Jared talked about. So as of yesterday, there were a total of 10,777 total cases of COVID-19 reported to Potter and Randall County, to the Public Health Department. 6,822 cases in Potter County, 3,955 cases reported in Randall County. We have a total of 7,380 recoveries, and we're up to 131 deaths reported in our community. That leaves us with 3,266 active cases as of today. Each of the cases do represent a unique individual. Locally, we have currently 138 people hospitalized with COVID-19. That's currently the highest number of hospitalizations we've had to date. So 138 people hospitalized with COVID-19. Adult bed utilization is at 82%. ICU utilization is at 89%, and ventilator capacity is at 49%. Our 5-day new case average is at 214 new cases per day. The rolling 7-day positivity average for Potter and Randall County is at 14%, and the positivity rate at the public health drive-through testing site is at 37%. The public health drive-through testing site does remain operational, and individuals can call 378-6300 to be screened and directed to the test site. Locally, we are seeing a significant increase in cases and a surge in hospital capacity. Public health and city leadership have discussed the need to move back to the COVID status level red, and we've been working with communications, the city manager's office, and public health authority, as well as the hospital's medical directors, to establish an objective criteria to determine shifts between the levels so that we can move between those levels in a very objective manner. So we do have here on the screen for you what the new status level chart looks like. There's a few minor updates. You can see where we have status level yellow is to proceed carefully, and it includes the local capacity is adequate. Level orange is increase safety measures and local hospital capacity is limited. And then level red would be use extreme caution, and local hospital capacity is indicated as stressed. So those objective measures that we discussed between all of the different parties would be, to be at level red, we would need to have 2 of these 4 measures that I'll describe to be met, and then we would move to the next level. So level red, those measures would be adult bed utilization at over 80%, ICU utilization at over 80%, ventilator use at over 50%, and a 5-day case average at more than 80 cases per day. If we meet those, all of those, or 2 of those 4 measures, then we would move to level red. We would stay at level red for 2 weeks. And at the end of that 2 weeks, there would be an expiration of the level red where we would reevaluate the criteria. If conditions were still at level red, then we would move back to the status level red for an additional 2 weeks and then reevaluate every 2 weeks. So status level orange would be adult bed utilization between 60 and 79.9%, ICU utilization between 60 and 79.9%, ventilator utilization between 30 and 49.9%, and a 5-day COVID-19 case average between 50 and 79 cases per day. The yellow status would be adult bed utilization less than 59%, ICU utilization less than 59%, ventilator utilization less than 29%, and the 5-day COVID-19 case average between 10 and 49 cases of COVID-19 per day. Blue would be normal patient capacity at the hospital, 5-day case average less than 9 cases per day, and the vaccine is widely available in our community. So those are the objectives to kind of determine when we would move between levels. Based on these metrics, we will be moving to level red tomorrow morning. All of the communications tools have been updated to reflect this information. The report card has been updated, and I'll let Stephanie pull that up for us. You can see on the report card, it includes a description of what the status level red means. And so that will be a very, like a quick at a glance for our community to know kind of what that status level red means, which we think will be very helpful. But the other information doesn't change, just that status, the status description at the bottom. The other handouts have changed, so the poster has also been updated. And so this can be used for businesses, community members, and other organizations who can post it on social media or at their physical location so that they know, everybody knows what to expect with status level red. And all of these tools will be on our website as of tomorrow morning when we move to status level red. So we'll talk about GA32 in just a very brief detail as it regards to the numbers, that 15% threshold. So on the state level, the governor did sign GA32 on October the 7th, and that superseded GA30. Mr. Miller will talk about those pieces in detail, but I just wanted to touch base on the calculation. One of the updates to GA32 was that calculation to the percentage of the hospital capacity. GA30 calculated the number of COVID-19 hospitalized patients as a percentage of all hospitalized patients. GA32 calculates the number of COVID-19 hospitalized patients as a percentage of total hospital capacity. And so with the denominator expanding, so GA32 really expands the denominator, and so that drives the percentage down because the denominator expands. So instead of the hospitalized patients in GA30, GA32 takes into account the entire hospital's capacity, not just those patients that are hospitalized. So our 25 county region is no longer above the 15% threshold. So we're in trauma service area A. This executive order outlines, specific requirements for counties reopening, and I'll let Mr. Miller explain those in detail. Under GA32's calculation, yesterday's hospitalization percentage was 11.41%, just over Monday's 10.4%. So it was a change in the calculation. There was no error in the calculation. It was just a change in the way that calculation was conducted on a state level. So that change was completely at the state level.
I think it's important to note also that the hospitalization rate by the new formula has been trending upward every single day since that new formula came out for our trauma service area. Mayor?
Yes, sir.
So Casey,
Jared, I would definitely want to come back to that point with some questions for Casey, but when did the governor make that change in calculating and that change in formula for calculating that rate?
So even though GA 32 goes into effect tomorrow, they changed the calculation over the weekend. And so they're no longer sending, they're no longer enforcing the old calculation.
Okay.
And so on the website, yes, ma'am, on the website, it has the new calculation on the website, and it even has the new calculation for historical information.
Okay. We made that change as soon as we knew he was making a change.
Yes, ma'am.
Okay.
So Casey, can I ask one question real quick?
Yes, sir.
That 138 that we have currently in the hospital, is that including patients that are at the VA?
No, that does not include patients at the VA. And we don't include that because not everyone can go to the VA.
Correct.
Only veterans can go to the VA. There's an additional 5 patients today at the VA.
Right. That's why I was asking, because I knew of a couple of them personally that were at the VA. And so that's why I was curious if they were part of it, because then you have to do this, not include the VA, because the governor's office doesn't include the VA in our count either.
Right, and because not everyone can go to the VA, only veterans can go to the VA, we didn't include that in the overall percentages because our entire community doesn't have access to that service. So wanted to talk just a minute about local spread. So we're still not seeing major hotspots or large outbreaks like we were seeing back in the April-May timeframe, but we do have generalized community spread. We're seeing spread within youth sports teams, family get-togethers, birthday parties, workplaces. Our contact investigators hear time and time again how patients thought they had allergies and they continued to go to work before they were tested. And so that's just a very important piece. If you think you have allergies, please look into it further. Stay home if you're symptomatic. Symptoms can be very minimal, they can to quite severe, and everyone is different, and you don't know which category that you'll be in until it's too late to know. We've had husbands and wives die just minutes apart. We've had healthy adults pass away within just hours of becoming ill. And one of our nurses was contacting a patient, and she contacted the patient just moments after the patient received a phone call that their spouse passed away. And so our nurse was the very first one to comfort the patient after her husband passed away. And so there's just lots and lots of very sad stories. And so we want to make sure that prevention is on the forefront of people's minds, because at least 131 families in our community have had devastating results. And so prevention, it's just so critical that we think about all of the prevention efforts. We have some statistics to share with you. The communications team pulled some data that was really interesting. And so excluding any anomaly reporting like mass testings at the prison or at the beef processing plants, 16% of our total cases have occurred since October 1st, which is only 5% of the time. 5 of the top 10 reporting days of the total increase have occurred in the last 5 days. 7 of the top 10 days have occurred in October alone, and 3 of the top 4 days of increase have occurred in the last 4 days. And so we have lots and lots of spread occurring right now. And again, it doesn't spread linearly, it spreads exponentially. And so we've got to just remember to wear our masks. We've got to remember to social distance, wash our hands. Again, just remember that Swiss cheese model, that it takes all of the prevention efforts to make a difference. And the last point is our communications team has been working on a new battery of tools, of communications tools that will be on the Amarillo Alerts website and social media today with regard to patient education and information. We have new handouts and videos for people to use the information, and there'll be information such as what should I do if I'm positive? What should I do if I'm exposed? Should I get tested? What should I do to avoid getting COVID-19? And we also have handouts developed clinical in nature that we have sent to local providers that they can give to their patients who are positive. And we have in development now a handout for people who are exposed that is very clinical in nature, so that physicians can hand the same to their patients, the information for the positive patient that they already have, but then they can give them the handout for positive patients and for their contacts, or the people who may have been exposed. And so we're really working hard to make sure that people have access to information in lots of places. They can go to the CDC website, the DSHS website, and then always go to AmarilloAlerts.com for local information. And our communications team has really put together some very drilled down and very simple information on what you can do if you're positive, or if you live with someone, or if you've been exposed to someone that has COVID-19. And some really great videos as well. So they're all being translated now.
Any questions on everything that Casey has presented? It's a lot of information, probably the most movement we've had in some time with new information.
Can I make a couple of comments real quick?
Yes, sir.
Sure.
So here's some things that have really been striking me as a healthcare professional involved somewhat in all of this up to this point in time. It's devastating when families lose a loved one, and I can tell you that we've been praying for those 131 families that have lost someone, and that is such a devastating thing to go through. But as a healthcare professional, also, I don't want to downplay the mortality of it, which is, we've heard all of the numbers about it being as little as 5%, and in some age categories as little as 1%. But the other problem that doesn't get spoken to very much is the morbidity of it all. And the morbidity of it all can be every bit as devastating, if not more devastating, than what's going on. We know that the figures are showing that somewhere between 6 and 25% of active cases end up having a hospitalization of some sort. And we do know that about 19% of the cases are moderate to severe cases, and that means that those patients actually have, here's just some of the things that they end up having to deal with. Pneumonia, they get septic, which basically means that they have a blood-borne infection because of their system being down, acute kidney injury, heart problems. They also end up having, a lot of them have blood clots in their lungs, and one of the ones that is so hard to pin down is going to be all the neurological effects that are lasting. And these actually, they don't go away in 14 days. They may hang on for weeks or months, or in some cases, there's some that they're afraid that they could actually end up being a lifetime. So this isn't based upon fear at all. This is just truly the facts of the deal. And that for those who seem to be not concerned with it, you still should be concerned with it because you may survive this disease, but all of these side effects or complications, they're no respecter of age or any other kind of category. And so I would also tell you that wearing the mask and social distancing and washing our hands, those are going to be so critical over the next set of days that and weeks and months, because number one, I don't want to get sick. And number two, I don't want to have any lasting effects that go along with this sickness. And so we can talk about the mortality, and that seems to be what everybody makes the news all the time. But the morbidity part of it, these complications and these side effects, they're not talked about quite as much, but they can have every bit, if not more devastating, and it will affect more people than the actual mortality part of it will. And so it just continues to go on. And the other fact is if you end up having a hospitalization, the average cost in the U.S. right now, if you don't have insurance coverage, is about $73,000 if you're in the hospital. And if you do have some insurance coverage, then it drops to maybe as low as averaging about $36,000. So this is a huge cost on our community and on our nation. And so all we have to do is wear a mask, wash our hands, keep our distance, just be careful and think of everybody else that's around you, and we can be very successful with this.
Are there other comments or questions for Casey? There was a lot of data in there.
Yeah, Casey, can you talk a little bit? You mentioned the 138 hospitalizations right now, and that's the largest we've had during this entire pandemic, even when we had over the 4,000 cases. So just, I know our hospital staff is feeling a lot of pressure, a lot of stress on the increases. How close do they feel we are kind of to maximizing out our ability to serve through our hospitals? And then you may want to address this, or Kevin, you may want to address just kind of the backup plan to that. If we got to an overload of what's our plan B on being sure that people do have medical care?
Yes. So, and one of the things I think is really important is, continuing to have the disaster declaration that allows us to tap into resources that we wouldn't normally be able to have. The hospitals are utilizing that, especially with access to additional resources like nurses and different staffing levels that they access through the RAC. This 25 county region is our Panhandle RAC region, and the RACs serve the hospitals in times of disaster. And so they're serving the hospitals now. And one of the main things that they're doing is they're accessing PPE and they're accessing surge staffing. And so the hospitals are certainly on the beneficiary side of those, especially with those two components. We have the plans that we had worked on previously back in the summer with regard to the alternate care site. And so those plans are still in existence. Again, staffing is always something that you have to think about. And we do have access to some resources, but we need people to slow down on their gatherings, to really avoid gatherings, to wear masks when they do go out into public, because we have to think about that hospital capacity and the strain that it is putting on their the staff there. Because if you get sick and we can't assure that there's a hospital bed available, that's a real problem in our community.
So are you saying, Casey, that we're already using that surge staffing? They've already activated that surge staffing, and then is it more staff is more the concern rather than the beds, or both? And where would we get more beds rather than just staff?
So yes, they have activated and are using the additional staffing. And Kevin, did you have more information?
Yeah, so Councilmember Hayes, obviously me and you visited briefly yesterday about that. First and foremost, Casey's spot on, is that the two primary care hospitals, Northwest and BSA, have both been submitting requests to the RAC to request additional staffing to augment their staffing and basically surge the staffing. As we also discussed a couple of months ago, the state of Texas implemented their alternate care site plan and opened up centers and hotels and motels across the state, including Amarillo, where they basically had a convalescent center set up in a hotel motel with limited staffing, but certainly as a forward-leaning effort as we saw the numbers across the state climbing very rapidly. So in many ways, that is a demonstration of the capabilities that the state has been working and planning towards on how they would implement surge capabilities across the state for any number of jurisdictions. So across the state, we saw locations activated in every major city that is served by DSHS and the RACs combined. And that's using contract staffing to do that. So that's a capability really beyond what we're able to pull from local resources, because much of our local resources are already attached to medical facilities here in the community. So we rely on that surge capability from the state. That's what's so critical about us staying in line with the disaster declaration that the governor has been publishing and putting forward, because in effect, we are saying that our jurisdiction's capabilities are maxed out and in many cases exceeded. Specifically related in our case, the opportunity to pull in PPE, testing supplies, and medical professionals to augment our hospital staffing are the primary areas where those resources have been deployed. So it just keeps us right in the loop and working closely with our counterparts at both TDM and DSHS with the state.
I think one thing interesting to note that nothing has been said is if you take the 138 that are in the hospital here in Amarillo and you divide that by hospital capacity, which I believe is 940 between the two hospitals, we're at 14.68% based upon how the governor does that. So I understand we should be very cognizant of the fact that we are stressing our hospital pretty significantly right now.
And that's compounded by the fact that Amarillo is the primary location for the most wide-ranging of healthcare available in our Panhandle area. So a lot of the people, even if they have hospital capacity in the surrounding TSA counties, trauma service area counties, a lot of those COVID patients are coming here for their care.
Any other questions from council? Casey, how many of those hospitalizations are they mostly Amarillo citizens, or are we really reaching stress on our hospital levels due to Panhandle-wide patients being in our hospitals?
Right now, they're mostly Amarillo patients. The hospitals, when I talked to them yesterday, they're really not able to accept many transfers right now, just because of the capacity issues. And so the hospitals in the region, so like in Dalhart and Dumas and the other hospitals, are really sending patients, and they are having to send patients as far away as Oklahoma City because like Lubbock and some of the other closer hospitals are also feeling the same stressful situation.
And I want to emphasize that COVID is causing the stress on our hospitals, but it just won't be COVID patients who receive less than our best care. If I have a stroke or a heart attack or some urgent need, the hospital is still full. doesn't matter necessarily what caused it to get there or what type of patients are in there. So I just want citizens to stop for a moment and think, this is not just about, am I scared of getting COVID or scared of the effects of COVID? It's actually about our entire hospital. And they use that hospital to treat all of us for things that are known and unknown and are very scary and life-threatening. So just think, I ask my kids sometimes, I say, play the movie forward in your head based on the decision that you've made here. And I want all of us who live in Amarillo to be playing the movie forward, because our choices are affecting not just us in our city, they're affecting our ability to leave our hospital doors open for people who live in Groover and Sunray and Booker and all in the Panhandle region. Those urgent care needs, emergency needs, don't have beds at our hospital because we are not managing our COVID numbers. We're not keeping them flat. And so I wanted to bring that up. I wanted to say this affects everyone who needs a hospital bed, not just a COVID patient that needs a hospital bed. And Casey, I really appreciated those questions by Councilmember Hayes about what is the plan to, when we have surge, what are our hospital surge plans? But I want to say to citizens, it's not up to the hospital to figure out the surge plan. Yes, they have those plans. They will surge as much as they need to, whether that's putting people in beds in the hallways, calling in nurses to work extra shifts. But I want the citizens of Amarillo to be doing what we can, walking beside them. It's not just their plan. It's our plan in the city. What are we doing in the city that lessens the burden on them? And I know it's tempting to let life slide back to normal and not wear your masks and pretend COVID is not happening. But COVID is happening, and we need to be responsible in how we're helping the hospitals to manage their load. So yes, they have a surge plan. But I would posit that we actually are the first plan of attack. We as citizens making the choices we make every day when we go to the grocery store, when we go to our kids' football games, all of the things that we're doing to keep our city open. And I want our city to stay open. But the small choices that we make to protect others, not really to protect ourselves, but to protect others, those small choices have a big impact. And where we're letting down on the small choices, we are seeing that affect our hospitals and the number of patients that are in our hospitals. So I am asking for help from the citizens of Amarillo to keep doing the small things that make a difference in how we, in our hospitals, in our hospital staff, have the capacity to take care of all people that are sick, not just COVID patients. Any final comments or questions for Casey? Okay, Casey, we appreciate the work that y'all are doing. And a couple of times you said that'll be on our website up tomorrow. Can we just say out loud what that website is for everybody to know?
Yes, it's www.amarilloalerts with an S, amarilloalerts.com.
Okay, thank you very, very much. The next item on our agenda. Oh,
well,
go ahead.
If there's nothing else on that, I did want to touch on a couple of things with GA32 very briefly.
Sure.
And Casey's going to stick around in case this triggers any questions that council might have for her, me, Kevin, anybody else associated with this process. GA32, as Casey said, replaced GA30. One of the biggest things, and I'm going to hit the high points on this, one of the biggest changes is that every business establishment in Texas shall operate at no more than 75% of the total listed occupancy of the establishment. Now, there's a number of exceptions and caveats to that. But for the most part, every business, as long as we're not an area of high hospitalization, is allowed to operate at 75% capacity. There's no limit for essential critical infrastructure, religious services, local government operations, child care services, youth camps, sports programs for youth and adults, schools, public or private, drive-in concerts, movies, or similar events, and then also establishments that operate with 6 feet of social distancing, like hair salons and tattoo parlors, things like that. In areas with high hospitalization, which is calculated as the number of COVID-19 hospitalized patients as a percentage of the total hospital capacity. So if that's above 15%, that's an area of high hospitalization. So in areas with high hospitalizations, any business establishment that would otherwise have 75% occupancy is reduced to 50%. So if we ever do exceed that 15% number for 7 consecutive days, then we will move to an area of high hospitalization, and what was used to be 75% is going to drop down to 50%. All of our indoor, professional, collegiate, and similar sporting events, indoor and outdoor, are restricted to 50%, and that's the primary areas where we have a 50% restriction. There's one other notable one. Restaurants that have less than 51% of their gross receipts from the sale of alcohol and whose customers eat or drink only while seated can offer dine-in service. They're also allowed to operate at 75%. The biggest, one of the most noteworthy areas of GA32 relates to bars. Bars that hold a permit with the Texas Alcoholic Beverage Commission, TABC, may offer on-premise services up to 50% of the total listed occupancy for the establishment if the bar or similar establishment is not in an area with high hospitalization as defined earlier, and the county judge of the county in which the bar or similar establishment is located files the requisite paperwork and forms with the TABC. We don't know if that's happened yet. We are in communication with the county judges for both Randall and Potter counties, but we do not know if that has happened yet. So we don't know if, at this point, if bars will open in the Randall and Potter County areas tomorrow. Patrons at bars may eat or drink only while seated. That's another thing that's very similar to restaurants. That's all I have with regard to GA32. All of the rest of it is very similar to GA30, which we've talked about frequently. And we'll touch on this information again tomorrow during the press conference. Does Council have any questions I can address for them regarding GA32? We are working with all of our jurisdictional partners and with our bars to, in the event that that is available to them, to enable them to move as quickly as possible to do that and do that in a way that complies with the governor's orders.
So it's up to the county judges as to whether bars will be opened. It's not up to the municipalities.
Correct. It is up to the judges to decide whether or not the bars will open. The governor's instructions also direct them to assist with the impacts of opening bars. We'll coordinate very, very closely with Potter and Randall counties. We're absolutely confident that we can work with any associated impacts of the bars being open. But they're going to have a role in that, and we'll work with them. TABC, we're working with all of our jurisdictions and agencies that have a role in this. TABC, one of the ones we're communicating very frequently with through environmental health. That's all I have.
Questions? Okay. Any other questions or comments then on coronavirus, Council? The next item on our agenda is item 1C, and it is an update on the timeline for the Amarillo hardware acquisition. Mr. City Manager?
Yes, ma'am. We discussed and entered into a contract in recent meetings to acquire the Amarillo hardware, not just the Amarillo hardware building, but all properties associated with the ownership of that building. So there's 3 main properties associated with the Amarillo hardware acquisition. The primary building, which is the large building, has Amarillo hardware on the outside of it. The warehouse just to the north, exactly across the street from the Amarillo hardware building, and also the property across the abandoned railroad tracks to the west from the building just to the west of the abandoned railroad tracks of the Amarillo hardware building. We discussed during that acquisition process that there is merit to considering purchasing, closing on the property and actually purchasing it, regardless of how the outcome of the election goes. But I wanted you to be aware of all of the steps that will need to take place and your available meetings at which to consider whether or not to purchase that property as we, in the lead up to the November bond election. Obviously, if the bond election is successful, there's a very compelling reason to purchase it because we will not have a city hall eventually if we go forward with that project. And Amarillo Hardware is considered as a proposed location for a future city hall. There's also merit in moving forward with that as a future location for City Hall, even if the bond does not pass. And that's in light of the known costs to renovate and make usable into the future our current City Hall site, which is going to be very cost prohibitive. So we anticipate that we can acquire and renovate and begin use of the Amarillo Hardware facility as a City Hall site for less than what it would cost to renovate and expand our current City Hall site. So in light of all of that, we wanted to make sure that you knew now exactly what the steps are going to need to be, regardless of how the bond election goes, if we choose to buy or not buy the Amarillo Hardware, to close on the Amarillo Hardware building. So I want to have Andrew give a real brief presentation, and then we can answer any questions that you have. Andrew?
Yes, sir. So we've got just one slide here just to cover the highlights of the agreement. So the contract effective date was September 10th, which was shortly after council approved the agreement. We show the purchase amount there of $4.750,000 or $4.7 million, $4,750,000 plus closing costs. We highlight there for you the November 3rd Convention Center bond election. The council meeting schedule proposed are a couple of action agendas available on November 10th and the 17th. And then the feasibility period ends on November 19th. So that's basically the drop dead date to be able to make a decision to move forward with closing or to not purchase the property. So far, we have completed the phase 1 environmental site assessment through Talon LPE. They did not find any presence of items that needed further investigation, so they did not warrant going into additional phase of the environmental assessment. And we are also working on the appraisals of all, basically 3 different appraisals, one for the building to the north, one for the main Amarillo Hardware building and the buildings to the west, and then the parking lot to the southwest. And we should have all of those completed sometime this week for review. But that is really the main takeaways and the time frame for considering this contract over the next month.
So, Andrew, just to be very clear about it from the council's point of view, election on the 3rd, then we would have 2 council meetings after the election to take action before the feasibility period ends. Now, we can cancel that contract if we want before the feasibility period ends, no questions asked. Is that correct?
That's correct.
Okay. So I wanted all 5 of us, council, to be on the same page about how tight the time frame is going to be to make a decision after the election, and wanted the 5 of us to have a chance to roll this around in our minds, have these time frames lined out, because that closing date is going to come on us fast. And so if the bond does not pass, and this is something we want to move forward with, essentially we'll have a very tight time frame to ask questions or get information. So this item is here on the agenda today so that we as a group can begin to talk through any questions we might have about moving forward with this project as a standalone project, even if the Civic Center bond does not pass. And if we need to put this on the agenda for several weeks to come, we absolutely can do that. But I didn't want us to try and shove that decision into that 2-week time frame. I know it feels strange to be considering it without knowing that big piece on the election results. But I think prudence requires that we think on it because the timeline is going to be short. Are there any pieces of information that you guys want to have in front of you? What do you need in order to make? Do you have what you need in order to make a decision either on the 10th or the 17th, should we be in that situation?
So here's my one question that I would ask. So currently we have an estimate on what the potential cost of renovations that are desperately needed for the current city hall. And we kind of also have an estimate of what it would cost to, if we were to go through and to purchase the Amarillo hardware buildings, what the renovation cost would be to get us to a city hall that would be in a great city hall for us if we used the Amarillo hardware building. So could you, I know we've got those out there, could we just go through that part one more time? Because I think that may be some of the most critical part of it. Because I can tell you right now, I know we've got to do something as far as updating our current city hall.
Yes, sir. In a nutshell, the estimate for updating and renovating our existing city hall, because of the age of all the systems, the boilers, chillers, all the technology, the phone lines, the lack of ADA accessibility, and other things, those costs are estimated anywhere between $17 to $29 million, just depending on the scope of the project. Including acquisition, the Amarillo hardware site, and understand that we have not designed it yet, is estimated between 17 and 22 million. So it does look like a very value conscious way forward that does take advantage of a historic building in downtown Amarillo and preserves the opportunity, whether the bond fails or succeeds, to do a similar project that is depending on how people look at it, either very necessary or something we're going to have to look at in the future if we don't do it now, to expand and renovate the Civic Center and to consider a new arena. So that preserves all of those opportunities in addition to being a more cost-efficient way forward.
Okay, so one more question. So in this cost to renovate the current City Hall, does that provide more accessibility like drive up?
No, that's a good point. In the scenarios that we have and the preliminary, very rough designs that we did when we evaluated the cost of renovating and expanding City Hall, there is not an opportunity to have a drive-up lane, which is a good customer service feature that we do have designed into the Amarillo hardware site if we go forward with that.
So there's actually more advantages for customer service in the new site for less money than there is for completely refurbishing the current City Hall.
Correct.
Okay.
Jared, I know you've talked about needing more square footage for the departments that live in City Hall. Does that $17 to $29 million number include expanding the footprint of existing City Hall?
The square footage that we would build initially in the Amarillo hardware site is around 70,000 square feet, which is slightly more than what we have in our current City Hall. But one of the key things to consider there is that the Amarillo hardware building has double the square footage that we currently have available to us. So we have a significant amount of expandability there. And I would not propose that we develop the entire building right off the bat, but it would give us the ability to grow our City Hall facilities as we grow as a community and as we have a need for more space for our community to use and for the organization to use.
So does the $17 million to $29 million repair and update estimate for existing City Hall, does that include building onto it to increase the square footage? At
the most expensive version it does, but it's not primarily that expansion is not so much usable office space as it is reorienting the entrance of the building from the parking area that we currently have that faces the outfield of Hodgetown. Instead, it modifies the primary entrance to being right along Buchanan, and includes an entryway, a large annex entryway. So while it does increase the size of the building, it doesn't necessarily increase the usable space and office space of the building.
So we still would have a problem of decentralization of all of the different offices and departments, whereas if we go with Amarillo Hardware, then you can still consider centralization and pulling most of the departments underneath the footprint of the new city hall.
Yes, and it would give us a lot more flexibility because we have so much more space to be able to move departments from Sims to hardware or hardware to Sims and all of the different buildings that we have downtown. We would have a lot more flexibility to locate departments in the areas where they can be most efficient. For example, being able to put all of the departments that fall into the development services category that we were talking about earlier that report to Andrew Freeman, the managing director of that, be able to co-locate all of those services in the same building when they currently are not. So there's a lot of advantages that we would have by having a building like Amarillo Hardware that is less expensive to renovate than modifying our existing site, and would give us all that flexibility as to where we locate apartments. At the end of the day, we wanted to make sure you all were fully informed and kept up to date and abreast of where we were at in the process, and then where your decision points were going to be in the process.
Elaine, question, comment?
Well, I appreciate the information, and I think that a lot of citizens probably are not aware of the current needs assessment on our current city hall and what some of the projected costs of potential renovations are on that building. And so I think that's great information for people to have as they are making decisions this November. But, you know, as far as from a council standpoint, needing more conversation, needing more information, the time period is going to be adequate. One of the specific reasons we as a council chose the timing to not close on this property prior to the election and to have plenty of time for the feasibility period is to not have the cart before the horse and to be able to hear from voters first before making that decision. And so, you know, all of that information is, I think, already on our radar, on our screens. And I personally am not going to feel that there is a particular rush on that time. But I think the most important decision first, and we discussed it at great length, was to be sure that we did not have a commitment, we did not have a closing prior to the November election. And we are still on schedule as it is currently set.
Yes, ma'am.
Anybody else? Okay, so I'm not hearing that you guys need another agenda item before maybe the November 10th or 17th meetings. Am I reading that wrong?
Yes, ma'am.
Okay, so we're in agreement with that. Howard, you're in agreement with that?
Yes.
Okay, all right then. Just wanted to make sure that we as a council had a chance to ask questions or get anything we needed. So I think we've done that. Let's move on then to item 1D, which is an update on the Task Force for Greatness. Mr. City Manager.
Well, Mayor, in response to council direction and mayor's direction, along with Councilmember Powell, we have been working with nominations suggested by all council members to identify participants in the Task Force for Greatness. Much like many of the committees that we have appointed recently, we've made sure that this is as reflective of our community as we can make it from every standpoint that we can find, from a racial standpoint, from a geographic standpoint, from gender standpoint. We have a committee very representative of our community. And regarding the task and mission set forth for the Task Force for Greatness, and the primary goals of that are racial unity and equity. We have put together a recommended group utilizing the suggestions and nominations made by all of our council members to put together a group that, and I think at this point I should probably hand it off to you or Councilmember Powell to go over the recommendations for that task force. But we also have a map showing where everyone lives and who we're putting on this committee. So if you can go on to the next slide. Stephanie? There we go. So we have 16 people that are proposed. We had actually nominated we had many more than that, but we had considered 17 people, one of whom we have not been able to reach as yet over the course of the last week, but we are continuing to reach out to him to see if he's willing to participate, but that's something that we can get them up to speed if we do hear from them. As it stands, we have 16 members that we would recommend to the council or to the mayor as placing on the task force for greatness. Would you like me to go over those names, or Mayor?
Do you mind, Jared?
No, ma'am, not at all.
There you go. Thank you, Stephanie.
Proposed as the chair is Dr. James Tudman, Reverend James Tudman. As vice chair, we got as vice chair. As vice chair, we have Christar Heavenbills, and then and you can see the council member that nominated them on the right. We also have Liz Elenese, Helen Burton, Kara Gilbert, Lisa Harris, Curtis Johnson, who called me yesterday just to make sure that he didn't need to be at this meeting. So he's really excited about participating and making a positive difference in our community by participating on the Task Force for Greatness. And I know that everyone else is too, but I thought y'all would find that interesting that he is on top of it. Robin Malone, Dr. Sameh Mawad, Brian Pennington, Russell Pennington, Rosie Powell, Twana Powell, Tommy Spencer, Laura Street, and Gus Trujillo. Of note, the Powells and the Penningtons are not related to each other.
Councilmember Powell, do you have anything to add? I know you've been every step of the way of this process. I'd love for you to share your thoughts about where we've landed and where we're going from here.
Now, I am extremely satisfied with the makeup of the Task Force for Greatness, and I'm just so appreciative for everyone that was nominated, that they have accepted the offer to be a part of this committee and to move our community forward. I just want to say thank you so much to Dr. James Tudman and then to also Christar Havenbills for their leadership. And we have, with this group, percent leadership on this committee, and they are leaders within our city. So I am so proud and excited about our start.
I want to say thank you to each council member who y'all gave us very robust lists. There were lots of good leaders to choose from. And I think it's also important to note that the title of this group is Task Force for Greatness. And just to remind people where that comes from, it comes from our city mission. And the mission statement of our city is to create the best environment possible for every Amarillo resident to find and achieve their potential for greatness. So we wanted the vision of this committee to be bigger than the issues that we are struggling with right now, nationally and locally. We want to be tuned into that and work on them. But the committee itself has a much bigger vision for that. And we look forward to getting started with them, and am grateful for the leadership of Dr. Jim Tudman, and also we'll have a new leader at Vice President. Christar, Councilmember Powell and I have worked with him in the last couple of years since we came onto council, and I'm impressed with his leadership skills. So I'm looking forward to seeing them come together and work as a team to lead this great group of people, to listen to ideas on how we can make our city even better at social justice issues, racial equity issues, and any other issue that they think stands between us and greatness.
And also, Mayor, we had other individuals that were nominated too, which made it extremely difficult, but just want those individuals to know that as we move forward, we will be reaching out to them for help and assistance as well.
Yeah, I'm glad you brought that up. I think there will be many opportunities for this committee to have subcommittees as they work on I think one issue they want to work on pretty quickly is finding a way to honor Dr. Martin Luther King in our city. And so they may decide to create a subcommittee of people who have that interest as a passion. And so if you were someone who stopped us in the grocery store or sent us an email and were part of the list of people, long list of people who volunteered to serve, you may yet get your chance to serve on an issue-specific subcommittee that might come out of or be related to the Task Force for Greatness. Any feedback from the council on this? Well, I want to thank Councilmember Powell for her diligence and her leadership in structuring this committee, and she, I know, will be with them every step of the way as they launch and begin to have an impact in our city. So, Frida, thank you very much for all the work that you've done on this.
You're welcome. Thank you, Mayor.
Okay. The next item on our agenda is item 1E, which is an update on the Parks and Recreation Master Plan. Mr. City Manager.
Right, we have our Parks Director, Michael Kashuba, to introduce the topic. We also have our consultant working on the project to make the presentation. We expect around a 15-minute presentation, and then time for council to ask questions. But this is an update on our progress. Michael.
Thank you, Mr. Miller. Mayor and Council, Michael Kashuba, Director of Parks and Rec. The item today is just a brief update on where we are in the process. Obviously, we've gone through phase one, which was existing conditions. Today, we're going to focus in on our needs assessment. And then moving forward, we're also going to look at strategies and action plans. So with that, what I'd like to do is turn it over to our consultant, Cindy Mendoza with MIG.
Thank you so much for this opportunity. Are you able to see my screen?
Yes.
Excellent. We're going to walk you very quickly through our findings associated with the needs assessment, as Michael just mentioned. The key piece we'd like you to focus on, though, are these decision-making factors going forward, recognizing that we're summarizing what's happened in phase two, but moving very quickly into the strategies and recommendations that we'll develop for the park and recreation system. The needs assessment addressed 7 factors, and I'm not going to read these to you, but what I want you to realize is obviously there's a mix of different opportunities ranging from trails to parkland to facilities that we have to balance here, including programs, maintenance, and operations. But as you just mentioned in the discussion about the greatness of your community is very diverse. And because of that, when we talk about needs, we have to recognize that needs across the community vary tremendously. I think one of the key characteristics that we want to talk about that affects recreation citywide, though, is the fact that there is a lower than average level of spending on recreation and entertainment in the city of Amarillo. The reason we know this is because we can use Esri data that divides communities into 67 different tapestry segments, is what they describe them as. And they come up with cute names that in some cases don't really accurately describe the people of your community. But what they do provide that's very valuable is a sense of these different tapestry segments. How many of your residents can be characterized in these different categories, and what's their preferences in terms of leisure and recreation, and how much are they willing to spend towards that? And what this slide shows is that of the top 5 dominant market segments in Amarillo, the spending is lower than average. So for example, let's take the one on the bottom. The 48 number means that the spending of this group is 52% lower than the average spending across the United States. So what you can quickly see of the top 5 categories in your community, 4 of them are spending significantly lower than others do across the community. So what this means is you have a very different type of park system than many other cities do. Many cities are focusing on a pay-to-play model where they are encouraging people to spend money that support their recreation preferences and priorities and subsidizing only specific needs. what we find here is that there is a need in terms of recreation to subsidize more. That also affects the priorities we heard across the system. Last time I met with you, we shared our outreach findings, which showed, amongst other things, that the thing they liked most about their parks and facilities was the ability to walk to them. That's a critical point, especially in underserved, lower economic disadvantaged neighborhoods. We also heard that the prioritization of projects was affected so that they want the city to focus on renovating and improving existing parks and facilities. That scored much higher than either looking at new parks, new major facilities, or even things such as sports complexes and destination venues. But there really is a mix of things that we need to focus on here to make sure that Amarillo is providing the right size of parks and amenities and facilities going forward. So the first thing we want to look at is the amount of land that you have. Amarillo does have a lot of parkland. About half of it is located in these large regional parks, as you already know. So we look at things including the numbers of sites, the amount of acreage, something we call level of service, which is a metric that's commonly used to describe the acres per 1,000 residents that are served by these parks. That helps us compare Amarillo to other communities. Another thing we note, though, is that the city has not only city-owned parkland, but also, as you know, the mix of school parks that are maintained by the city. Some of these are city-owned, some are jointly owned, some are school-owned, but the city has been maintaining them. But what you realize when you look at the data this way is school parks are really minor in terms of the amount of acreage that they add to your system. That's not to say they're unimportant, though, because we look at park needs in a variety of other ways. But first, I want to ask that question that's been asked here as part of this planning process. Does the city have too much parkland? And really, that's a facet, because it's not the fact that you have too much parkland. Everybody says parks and green space are fabulous, even as we noted in the COVID era, how important they are. What really the question that's being asked is, do we have more than we are able to maintain effectively? Or are we trying to maintain too much given the costs that brings to the system? So the first thing we see is that when we compare you to cities across the nation who have responded to the National and Recreations Association database called Park Metrics, they've categorized these into different sizes. So of similar sizes facilities and cities as yours, most of these cities have 8.9 acres per 1,000 residents. Amarillo with school parks is much higher, 12.6. So yes, you have more parkland. But it's not all about land when it comes to measuring park services. We also measure park service in the number of sites you have, and in particular, the number of sites per residence that you have. And what we see there is that because so much of your acreage is tied up in regional parks, the city actually provides fewer parks per capita than the average of cities of similar size. And it's even much smaller when we take out school parks from that equation. That also tags to another type of metric that we use, which is park access. Park access nationwide is typically measured in the numbers or percentage of residents that can get to a park within a 10-minute walk. That's the industry standard and has been selected because a 10-minute walk, or roughly a half mile, is the distance that people are willing to walk or bike before they tend to get in their cars to drive. So the emphasis has been around a 10-minute walk. The city standard, however, from the previous plan that was done, is actually based on a 20-minute walk, so double what the industry standard is across the nation. What we find is at the 10-minute walk, only 46% of residents have access. But the other piece of that is what people are walking to. People more likely are walking to their neighborhood parks and community parks, as well as school parks that are intended to meet those nearby park and recreation needs. That's what they're for. Regional parks are intended to attract people from longer distances. And what we find there is that for your own adopted city standard in the 2012 plan, the city falls short. far short of providing parkland for parks of those types. So whether it's neighborhood, community, or school parks, you're not meeting your adopted standard, which is to have 5 acres per 1,000 overall in terms of those types of parks. So again, lots of land, but not necessarily in the right places for easy access. We cross-check this by our own GIS access analysis to look at the access that you have citywide for parks. And this is a really complicated map, so I'm going to boil it down to a couple of key things. First of all, kind of the lavender shade is around your city parks. The darker purple shades are showing service around your school parks. And the darkest colors are based on the 10-minute walk. The lighter colors that surround that are showing what would be covered within a 20-minute walk of your current park system. So anything that jumps out in yellow is a quick way of showing residential areas that are not currently served by any parks or school parks at this point. And then also we need to recognize that there are some new growth areas of your community where new residential areas are anticipated. So those are marked in these letters A, B, C, D, and one up here. So your coverage is relatively good at the 20-minute walk. But there's been a lot of conversations around school parks. So quickly, I want you to see the difference between this image, which is with school parks, and this one, which is what happens to park access in your community when we take out school parks. Now, when I say take out school parks, the key thing to realize here is that schools exist. They have outdoor recreation amenities and facilities. What the city has added is an investment in the maintenance of those amenities and facilities at selected sites, not for all schools, but key sites that have supported park access. They've also supported the development and reinvestment in capital projects on occasions at those sites. So people in all of these areas that are in yellow may still have access to schools. The city, however, would not have say per se in the recreation experiences that are provided there. They would not be supporting those in any way. So what you quickly see is that school parks do meet substantial needs across the community, and that gaps are introduced by eliminating those. But the other thing to factor in, to go to my original point, is needs are not equal across the city. And so the orange circles that we've added to these maps show pockets of higher density, low income, and in many cases, higher racial diversity areas where needs are different based on those circumstances. And one of the reasons we highlight some of these areas that appear to be served within a 20-minute walk is because within the areas highlighted in orange, residents are less likely to jump into their cars to drive to recreation opportunities. A higher income area, if we're taking kids to a soccer program or any other rec center, we're going to drop in our cars and we're going to drive. But if your parents are both working and you don't necessarily have that option in terms of getting to your local park or facility, having things closer to home is more important. So that shows us that needs are different. And then let's add to it the fact that these areas in the blue rectangles are anticipated to grow and add additional housing. There are some areas that, in this case, appear to be deficient on parkland, or where selectively certain school parks might make more sense to invest in than others. And certainly some are not needed because they duplicate service that's already provided. I'm going to go more quickly through the rest of the presentation, but just want to point out that, especially in the COVID era, trail demand and just a desire to get out walking and biking has more than doubled, but trail use is already high, typically, in most communities across the region and across the state. But in Amarillo, trails and walking, biking, and hiking are guided by a number of different documents, including the transportation plan, Our understanding is that while the Parks Hike and Bike Plan is anticipated to address trail needs in parks, that's really only part of the equation. And so the data that we're finding recognizes that there's a need for greater connectivity at the trails level through transportation, non-motorized transportation, and even regional trails planning that is now underway. Looking at major facilities, as well as the mix of amenities and facilities and parks, just very quickly want to point out that amenities are those support features in parks that tend not to cost very much but are important for park use. Then you have a mix of what we call outdoor facilities, the playgrounds, the picnic areas, the basketball courts that have a slightly higher cost, but again are not nearly the cost of what we call major facilities, which are those that have a stronger operational component and require significant investments in funding and staffing. What we find is that the community wants you to invest in the repair and replacement of everything you have from support amenities on up. That was clear through the asset management plan that was presented to you here a few months ago as well. But secondarily, the emphasis is on diversifying the opportunities you have available. Looking at different mixes of things that aren't yet available to people, such as bike pump courses and skills tracks, which is a different type of way to get people out biking than trails, since your community is deficient on trails. Does that mean you can't invest in major facilities? It doesn't mean that, but it does mean that in terms of finding the right balance of things to move forward, we'd want to make sure that any major facility investment would be of low risk in terms of costs to the city. Want to make sure that, as been proposed at John Stiff Park, there's an effective way to use the resources that you have available to bring in revenues for the system, but not necessarily commit to the development of a major new sports complex where the city's on the hook for the upfront development costs and then need to be able to guarantee operations going forward that is a higher risk. So certainly finding that mix and also looking at the role of the convention center within the park system as a type of indoor space will be important. With regards to maintenance and operations, the city currently spends less total on overarching operations. So that's operating your facilities, your golf courses, providing programs, as well as maintenance. And simply because of the economic diversity of your community, what we find is that some facilities need to be subsidized. The question to ask is whether which types of facilities should be subsidized, recognizing that different types of spaces, such as a golf course, will attract a different type of user than your swimming pool, for example. Looking at maintenance in particular, what we recognize is that the residents had indicated through outreach they would be willing to focus less on beautification, but certainly more on the upkeep of facilities that are there. But there's an opportunity to remove some of the higher maintenance facilities, such as restrooms in neighborhood parks that typically aren't provided in other cities. Neighborhood parks are intended to serve local nearby residents who can go home to use their restroom. So making sure we're right sizing assets and putting the emphasis on maintenance where it needs to be, which are on higher use parks with lesser maintenance of local parks. And then looking at ways to invest in programming. The city has a mix of programming that's not quite as diverse as we see in cities across the nation. And certainly we heard from residents the need for more community events, things that support health and fitness, and then of course programs for lower income residents. But all of this will have to be built around a cost recovery strategy. That allows you to place lesser emphasis on beautification, but integrate art into park development, not necessarily as standalone art pieces, but where it augments the experience in the park. So in summary, that leads us towards what we're seeing is some decision-making factors going forward about how we address needs in terms of the amount of parkland, park distribution and access, and the diversity of experiences. And as you all have been having conversations already, there is an opportunity to reconsider the function and role of school parks, but recognizing that these are still really important in terms of meeting needs in underserved areas, but may not be an important investment in areas that are already served. Certainly the trails coordination will be important going forward, and looking at the types of facilities that you can use to diversify park experiences when you replace these. As noted in the asset management plan, costs there are developed based on replacing like for like items of what you have currently, but what we're hearing from residents is that you may not replace what you take out with with a new thing that goes back in that was the same as it was before. And then as already is underway, we're continuing to look at options to evaluate high cost, low benefit parks and facilities, recognizing that for some like golf right now, we're seeing a resurgence in golf that is unheard of in past years. Again, an opportunity for people in the COVID era to be outdoors. So certainly that has affected cost recovery there. So in that case, you would want to kind of monitor and manage. But there may be opportunities to consider partners taking on a greater role in the zoo. And as I mentioned, removing restrooms and looking at leasing park out parcels to be able to bring in more revenues. And then finally, right-sizing the system by reducing the maintenance and beautification, creating land dedication requirements for parkland, and providing credits for built parks will be an important part of the development of new areas in particular. And then, of course, investing in park activation. This is a fast overview of kind of general conclusions from the needs assessment as we move into those recommendations and strategies and start to prioritize projects for the future. It's a really good time for us to pause, though, and check in with you all to see if these are the right directions or the right steps and what resonates most with you. Thank you.
Thank you, Cindy. Michael, you want to hear from council now?
Yes, ma'am. If there is anything in terms of strategy moving forward, or any kind of direction related to kind of the Parks Master Plan, especially as we move into kind of our next phases, phase 3 and 4.
Council, what are your thoughts after hearing that summary of information from Cindy?
I would say that it makes me have to sit down and really consider the school park situation again, because it looks like some of those parks become very critical and some of the parks are not nearly as critical moving forward. So I think it just means we've got to take a really hard look at exactly what's going to be important and what's not important. And then how do we fill the holes that are missing?
Well, and one of the things I wanted to just comment on briefly was, I know when we did the asset management plan, one of the things that became abundantly clear was we may have too many assets. And I think that's where we're starting to look at strategies on how do we reduce those costs. It's a lot easier to maintain open green space than it is to maintain a whole bunch of assets within that green space. And so I think that becomes the challenge of looking at those assets that we do have and placing them strategically, and then areas that maybe we have more than enough assets, start to take some of those offline.
So, Michael, what does taking an asset offline look like?
So I think if Cindy, if you don't mind pulling back up that presentation, I think at the end there was some discussions about some of those higher cost, lower returns, things like restrooms. I mean, as we mentioned, neighborhood parks are intended to be a walk-up facility where you're walking up to use those facilities. I know that there are restrooms in the majority of those, and we could still accomplish that if there is an event that there could be portable restrooms on site. instead of having to maintain the electrical, the water, the facility, the staffing, all of the things that are required to keep that in good condition. And as you'll see in the asset management plan, a lot of those are in very poor condition anyway. So as we start to look at those high cost, low benefit assets, I think that's really where we need to start looking at what is appropriate for the type of park and the location.
Does that mean you would just lock those restrooms indefinitely, or you would remove them?
I think we would look at where the biggest needs are. And typically your regional parks and your community parks, you're going to have people that are driving to use those facilities. And so in those parks, it makes sense to have restroom facilities. I think in those smaller parks, I don't know that the cost of maintaining and replacing those provide the benefit that maybe warrants that kind of expense. So again, it's going to be looking at it park by park, site by site, and trying to figure out what is the needs of the community, because obviously there's been a lot of overlap in past years. And so just trying to make sure that we are being good stewards of the city's resources.
So does that mean removing like the restrooms in those parks, or are you just going to shut them?
I think that's a discussion. We've got a lot of facilities that have aged probably beyond their life expectancy, and I think in those cases it would make sense to just remove them. In other cases where maybe they've got some life expectancy, possibly repurposing them in other places. I think it's going to be case by case as we look at each of those assets. But I do know that there's a lot of cost, whether it's staffing, whether it's replacement costs, and just making sure that those stay at a high level.
Cindy, could you go back to your map that had the different colors? And I wanted to ask if any of that is included, like our different neighborhoods that have PIDs where they have green space and they have walking trails. Is that indicated in here, or is this simply parks that we maintain outside of that?
So these are based on city parks, which are looking at those that provide neighborhood serving amenities. So that's neighborhood parks, community parks, even regional parks serve their surrounding nearby neighbors. And then this map has the school parks on it as well, but not all schools. It does not account for homeowners association parks and green space, for example, that are provided in addition to what the city requires in its own standards.
So that's interesting. Looking on this map, it basically says that Hillside Park doesn't have any parks in it, but doesn't Canyon Independent School District have a school? And I assume that every school's got a school park with it.
As a part of some of the discussions we've had with recent developers, obviously we weren't in a position to be able to take ownership of some of those school parks. So at that point, we left it at the discretion of the school district, whether or not they were going to build those extra amenities with that site.
So in other words, that Hillside does not have any extra amenities. It doesn't have any park or green space with it at all.
That's correct. Well, they'll have their standard school site, but they didn't add the additional acreage that typically would have been dedicated to the city. So in past practice, the school sites would get 5 acres for the school, or 10 acres for the school district, and an additional 5 for the city. So for a total site of 15 acres. All of those agreements vary in how they're written. But in this case, since we were unable to take care of what we currently had, we were not proposing that we get additional dedication in that location.
So does that mean that Hillside Park still does have their own 10 acres of green space, though?
It would have been the standard school, so it should be the 10 acres.
would be my only need on when we get to a point of looking at where our gaps are, that even though maybe it's something we're not maintaining, that it needs to be included for us to see where services are and where those true gaps are. I think it's still probably going to fall where those were indicated, but if there was another way of adding a different layer of coding, even though it's not just, we're analyzing the whole city, not just what we maintain.
We agree completely, and the needs analysis goes into a lot more detail in some of the underserved areas and the gaps that are noted here, and looks at opportunities. In many cases, there are either other types of schools that are present, or in some cases even private parks and facilities that are nearby. What it really showed us is that there's going to be needs for new parkland, primarily in areas that are new development in some cases, but then also focused on those underserved areas where it's an equity and access issue.
Cindy, can you look at the trails slides again, please? Yeah, that one. I know, I mean, recently I have an email from a family who, longtime Amarillo residents, and they have decided to relocate to Colorado because we have such poor outdoor and trail activity facilities. And so that was the reason that they moved out of the city. And then this weekend I spoke with a couple who have moved from out of state to Amarillo, and they're enjoying Amarillo. And the specific thing they brought up to me that they really would like to see us have more of is more trails, the opportunity to exercise and be active outside on trails, hiking, biking, running. And they were very surprised and disappointed at the lack of those amenities in our city. And so they're thinking that in the next year or two, they probably will move back to the place they moved from just because of the lack of that amenity. And so I look at this information and I don't know how we change it, but I do think it's not just COVID related. It's accelerated or enhanced by COVID, but the desire for trails and just the desire to want our community as a whole to be more active, to be healthier, to spend time together as a family participating in these activities, that's real. I just don't know where we get the funds to do it.
Well, and Mayor, to jump in just for a second, one of the things as staff that we're looking at is going after some grants for things like trail development. I think also as we take a more holistic approach to things like the John Stiff project, if that project was to come to fruition, obviously that opens up a lot of doors for potential trail access connections. So I think as staff, we're constantly looking at ways to look for additional resources, whether it's grants, whether it's uncommon funding sources to try to meet some of these needs. And obviously when we go to make a case for a grant and we've got the master plan data to support it, I think it makes our case that much stronger.
You probably would like a more positive response, Cindy, to all of this data. And it's not that I'm not without hope. I'm not sure what our next step needs to be. It feels like the mountain is very tall.
I would agree with you on that. And we've got to do something to knock some of this mountain down.
I think what's going to be important in the recommendations phase is to set some clear priorities and some clear trade-offs that'll have to be made to be able to invest money where it's needed most. Certainly trails are a place and just the walkability of the community that are critical in order to make that happen. Currently the park system has many aging specialized facilities. And many systems, I'm not saying this is right for your system, but in many cities, the Parks Department is no longer responsible for the zoo, for example, because of the operational costs associated with that and the investment needed versus other types of parks and recreation opportunities the departments could be providing. This plan will lay out some clear choices that need to be made going forward. And as Michael mentioned, really sets you up strongly for grant funding. Certainly with the recent passage of the Land and Water Conservation Funds and some funding sources across Texas, there's a thought that as we move forward through the next few years, seeing the connections between parks and health will be critical, and that funding will be available via grants to invest in that.
Council, any other questions for Cindy or comments back to Michael and the city manager?
Yeah, I'd like to comment as a person that rides a bike as much as I can. And this isn't necessarily new news. It's brought up that we need to work on the connectivity. And by that, I mean, we may have places to ride in a certain subdivision or another subdivision, but they're not necessarily connected. And so with the pedestrian bicycle committee and Parks and Recreation committee, we need to work on connecting those. Some people want to ride longer rides and go from one subdivision to another. And now the money issue, that's a problem. Marking on the streets, it costs money, but it's less than building sidewalks and stuff like that. So I think we can do a better job of planning to connect things. And then a question I have is where we have schools and parks together, 5 acres or 10 acres, is the maintenance of those divided equitably the way it should be? Are we doing the city part of maintenance? Is the school doing their part? Or it's just a question I have.
In most cases, the way the agreements are written, and again, each school may have a different term related to those school parks, but in most cases, the irrigation is paid for by the school. The city pays for all maintenance of the park facilities. And that's just a broad general statement. But in most cases, that's what we see in terms of those agreements. There are obviously some that differ in terms of how those agreements were written, but that is the general underlying framework.
So is there a written agreement with each school/city park?
For the majority of them, there's a couple that we've still been going through our records to try to find some of those agreements. But most of them, we do have agreements in place.
Okay.
Cindy, is that standard with other cities that you work with and design plans? Is the partnership between cities and schools on the maintenance of parks, is there a best practices recommendation that you will be bringing forward?
There's not a universal rule on this. However, it does appear that the schools should be taking care of school facilities. That's part of their charge. While that doesn't necessarily ensure that they're open for recreation, schools that are not fenced, which actually vary state to state, are typically open to neighborhoods for recreation. However, there is, based on the history of the arrangement here, a notion that the Parks Department is providing some additional added opportunities in these school parks especially for neighborhoods then that wouldn't have access to nearby park opportunities. So that's where our recommendation is: be very selective in the schools that you invest in, but allow schools to step in and play a stronger role in taking care of those other sites. And I think I should also add that's also where the parkland dedication ordinance also comes into play, because it shifts the way that moving forward, parkland is dedicated to serve new developments. The intention is to have something that provides not only land, but also amenities and facilities there for nearby neighbors.
So, Michael, what do you need from us? We've given you feedback.
I think that was great feedback. What we'll do is we'll regroup with our consultant and try to figure out our next steps moving forwards. Obviously, we'll start going into strategy of how we move forward as a department, and then the action plan will come out of that. So I think you've given us some good direction. We'll regroup with our consultant and figure out our next steps.
One final comment. I am very moved. I think we're all very enthralled by that big map that has so much data on it with the purple levels, and on the northeast side of town, especially in the East Ridge area, our amenities are so lacking, and the kids there are really probably the most poor in our whole city. So emphasizing, I would say, putting toward the top of our priorities, getting them access to a park they can walk to and play soccer and the games that they like to play, I think is very important. But I'm very bothered by the fact that they essentially have so little in all of their lives, and they're also lacking in city park access. So I want to just put that out there as a priority.
If I remember correctly, when that part of town questions were answered from that part of town, they weren't as interested in the swimming pool part as they were in just green space to go and do their group activities. And so I would agree that that's something that we really have got to make for sure that becomes a priority.
Yeah, I think the main focus for that area was maybe like soccer and some other type sports.
Rita, I can't remember the name of the game that they played.
I was trying to think of that game too as well, and it just doesn't come to mind right at the moment.
The Kung Fu volleyball?
I don't think that was it. I mean,
Kung Fu volleyball.
But there was something very specific when you had that conversation of what the need was. And so it's just a great reminder that for us not to assume what needs to go in that gap, but we will be reaching out to the neighborhoods to find out what that activity looks like in their neighborhood, in their community. Because I am thinking it was something more specific, like soccer fields, softball fields, something that was a particular activity that was very predominant, very highly prioritized. And so it is one piece of the puzzle we at least have some feedback on, to know that there is a specific. We'll just circle back around to plug that in and pass that on to you, Michael, as well, as we begin thinking through recommendations.
Mm-hmm. Shouldn't that actually come up in the East Ridge neighborhood project, I would think, when that starts? And that ought to be starting relatively soon, correct?
It's a good point, yeah. Mm-hmm. Seems like, Mr. City Manager, it'd be really important for Michael to be in tune with that neighborhood plan as much as any.
And we'll make sure that he is coordinating with Emily Kohler and the planning team as they're working through that neighborhood plan process. Emily Kohler being our senior planner, who is also leading all of our neighborhood plan processes.
And doing a great job.
Yeah.
Yes.
Yeah. And thanks for pointing that out, Mayor, because that particular area, it is very, very diverse. with all different residents, nationalities. So
I think the name of the sport was Sepak Takraw or Takra, which is the combination of soccer and volleyball. So it's a very So
okay,
that was the sport that was identified.
Volleyball?
Yeah,
I mean, you basically use your feet to play volleyball.
Okay.
So I might want to take up that sport.
I want to be there when you do.
Yeah.
Okay. Very athletic day. So.
Okay. Anything else on Parks and Rec from the council? Okay, Cindy, thank you for joining with us today.
Michael, I just have one other question, kind of time frame. Just managing expectations of when you're going to take this information back and before we would probably see you before council again with any more follow-up.
We'll have to regroup with Cindy to get those specific times and dates, but we're going to try to move as quickly as we can through the next phases.
Okay. Let's move on then, council, to the next item on the agenda, which is an update on the Confederate statue in Elwood Park. Mr. City Manager.
Right, Mayor, thank you. We've had conversations with a number of outside parties that have have vested interest in the security of the statue, understanding I'm not making any political commentary, but understanding the controversial nature of the statues associated with Confederacy across the nation. We've certainly listened to those requests. We have received a request today, actually, from a local resident named Mike Moore, who is commander of a local Sons of Confederate Veterans camp, and who is working in concert with the Texas State President of the Daughters of the Confederacy. So it's a pretty solid request with people who have a vested interest in the history of the statue and its continued safety. So what they have requested authorization to move the statue. If you don't mind, I'll read the letter to you. I emailed the letter to all the council members immediately upon receipt. So it was just before the council meeting that we received it. We had planned already on talking about this and had been having conversations with Mr. Moore for some time. So we expected to have this letter, and we did get it. Dear Madam Mayor, Silent Henry Monument, which was given to the City of Amarillo and placed in Elwood Park in 1931 by the United Daughters of the Confederacy, was paid for from private funds raised in bake sales and other activities over a 15-year period by the widows, daughters, and other relatives of our local 150 Confederate soldiers. As the commander of the local 42-member Sons of the Confederate Veterans Camp, I am authorized by the Texas State President of the Daughters of the Confederacy, Mrs. Dorothy Nord of Bedford, Texas, to speak for her. Our preference is for the monument to stay in place. However, the statue continues to be vandalized, and we share the city's concern that it may be permanently damaged. I believe we need to take action quickly to keep the monument from being destroyed. I request that our organization be allowed to relocate the statue in a place of honor at the Armstrong County Courthouse in Claude, Texas. As an aside, I believe he has already spoken with the county commissioners in Armstrong County, and they are supportive of the request. The Texas Division of the Sons of the Confederate Veterans will pay the labor and other charges to dismantle and transfer the statue to Armstrong County Courthouse in Claude, Texas. Elements that are in the works are exact location and contact with a cement company to build the platform that will hold the statue. Thank you again for hearing us out. Please let us know if you have any questions or concerns which we need to address. Very respectfully submitted, Mike Moore. So we do have a request from, I believe, both the Sons and the Daughters state groups or local group with regard to the Sons, state group with regard to the Daughters of the Confederacy, who placed the statue in that location originally. So I wanted to get your input and seek your consensus on what direction you would like me to take on that.
Council, comments?
Well, Mr. City Manager, based on the information that we have just received, I'm definitely ready to move forward with it. And we do have something in writing from Mr. Moore stating that they would like to, handle that process and take care of the cost. So I'm certainly in agreement with that.
I would agree also.
I agree also.
I agree.
And I do too. So I think you have a consensus to move forward, and we want to see that statue protected. And I think this is a good avenue to ensure that's the case.
Right. We will evaluate all of the different components of the request from a legal standpoint and from all stakeholder aspects, and we'll move forward accordingly.
I think that's good. To protect it as a piece of art and a piece of history, I think is prudent.
Yes, because I don't want to see the statue destroyed. I mean, I think we see enough of that on a daily basis. So.
Okay. The next item on our agenda is an update on the state of the city, and was different this year, as many things have been different, but I think I've come to really enjoy that event as an opportunity for across different geographic and economic and industry levels. We have people come together, and it's sort of a pep rally for the city. We talk about the things that went well in the year behind us, and we talk about the challenges that are still ahead of us, and then we leave there feeling more connected and at least mission focused on what the next steps should be to make our city a better place to live in. And so this year, I decided to shift that event to an online event, and it's there for anyone to go and watch. There's an edited version of all of the different people that I talked to prepare it. But then we also posted the full interview segments so that you could see if you're more interested in what the doctors across the city had to say, then you can watch the conversation with the doctors. We did really expand. Normally, the state of the city just gives citizens and residents an idea on how their city government has performed over the last year. But this has not been a normal year, and I felt like it was important to actually give people a way of knowing what the state of our entire city is, not just our city government. So that website that we created just for that is called missionforgreatness.com, because our city is on a mission for greatness. And whether it's COVID or economic downturns or future uncertainty, we're still on that mission. And the only way I know for us to be on it and make progress toward achieving it is to have conversations, check where we are, check what's going well, check what's not going well. I think this Parks and Rec master plan information we just had, that was hard to listen to and to try and envision how we're going to do better on it, but we have to. That's part of our mission. So now we just have to put our hands on it and work on it. So I would encourage you, if you didn't watch last week, just make a time, 30 minutes, to go and check out that website. You'll be a better citizen, better informed citizen for having done so. And we appreciate citizens' support in staying up to date with information from the city. That's the update. Any questions? I know that Howard really missed out on the donuts, because we normally have donuts at State of the City.
I did miss that. Forget the coffee.
So thank you to each council member too for participating, and I enjoyed your comments. Our city is tremendously blessed to have the four of you as leaders and council members, and I could see your heart in reflecting back on the last year. I really appreciated what you had to say. If there's nothing else on that, then we'll move on to item 1H, which is to request future agenda items and reports from the city manager. Anyone have a request?
Mr. City Manager, I would like to request just an update on the Martin Road Lake project. I've had several questions recently on that and kind of get a status update on that. And something that we haven't heard for a while is kind of an update on our crime statistics, and kind of following up with just kind of the overview of what's going on, and compared to other cities around the country that have seen very large increases in crime statistics, I would be interested in hearing how we are doing locally.
If possible, if you have specific questions on, we'll obviously put together a general update on the Martin Road Lake project, but if you have specific questions, that'd be great to go ahead and send those so we can make sure that the update addresses those questions specifically as well, in addition to just an overall update.
I know we had a timeline that had been presented before, just to kind of see where we are on that timeline now, which things have been completed, where we are on things, and just to have an opportunity to have a conversation about what's going on with that project.
Okay, we'll do it.
Council, I would propose, we've been going for 2 minutes and we're now about to do our consent agenda. If you need to take a bathroom break, I would say just take that and come right back, unless the 4 of you would like to take a different approach and actually take a bathroom break. Anybody for taking a bathroom break?
I suggest we take a break.
Okay, there's one for taking the break. Okay.
Second.
We'll pause for 5 or so minutes and come back. Okay, ready to get started again. Our next item on the agenda is item number 2, the consent agenda. Is there anything there, council, that needs to come up for questions or further discussion? Not hearing anything, I would entertain a motion to approve the items on the consent agenda.
Yes, Mayor, I move to approve the consent agenda as presented.
Second.
All of those in favor of the motion approving the consent agenda, please raise your hand. Okay, that passes with a 5-0 vote. Moving down to our action or non-consent agenda. Agenda item 3A is to consider a resolution with a discussion and consideration of a resolution confirming and continuing the mayor's 6th amended declaration of disaster. And I'm going to ask the city manager to give us a little background on this.
All right, Mayor. The continuing the declaration of disaster for the city of Amarillo ensures that when we have a need for resources, we can access those resources through the state. Texas Department of Emergency Management, Department of State Health Services, and other entities are providing assistance to the city based upon our eligibility through the declaration of disaster, which is also a function of the state's declaration. To give us some details on why we would do this and what the benefits are, I also want to throw it to Brian McWilliams, our city attorney, to give us a little bit of detail, and then council can ask us any questions you want or take action. Brian?
Yes, good afternoon. Yes, it's very common when you have a disaster like we've had that continues on to renew and continue the disaster declaration for many purposes. And of course, we've had multiple executive orders that have changed some of the restrictions on businesses, outdoor gatherings, and that kind of thing. And it allows for not only the continuation of the disaster, but it also allows us to reset some of the rules locally to match those of the governor's order. And the resolution that's before you for consideration today, which is confirm and continue the last 6th Amendment disaster declaration by the mayor, and it will conform it to GA 32 that you've got a lot of information on earlier in the meeting.
Is there anything we can answer from council? I never want disaster declarations to become routine, but it is pretty straightforward and consistent with our past practices regarding the disaster declarations throughout the coronavirus process.
Any questions, council? Okay.
The time period. So again, what does this, when you renew, is there an expiration date if you don't renew an emergency order? And what does it look like to eventually expire?
Brian?
Council would need to probably take action on that, or the way the resolution currently, the way the language in it is now currently, because of the perpetual of this, the perpetuality of this disaster, it will just end when the disaster declaration is terminated by the governor. With the understanding that the council can always go back and terminate it on a local sense earlier than that. This just allows us to continue to respond in the way that we would need to concerning the pandemic.
To your question, Councilmember Hayes, it does not expire based upon anything written inside the disaster declaration. It would require an ending of the disaster or modification or elimination of the declaration by the City Council.
Thank you.
And we don't have any indication from the governor's office as to when his orders will expire, correct, Jared?
No, ma'am. No, ma'am. We do not. We do hear concern about some of the growth in numbers statewide. However, we are still the governor's office is still committed to a reopening plan, and GA32 illustrates a very gradual expansion of that opening plan. So I would anticipate that more of the same, unless we had some truly noteworthy numbers changes across the state going up or down.
It does concern me that the governor has continued to extend emergency orders. And I know locally we have short time periods where you, Mayor, could declare an emergency without confirmation from the rest of the council. And I do anticipate that is something that's going to be addressed in the next legislative session to kind of close that loophole that has allowed this long time period for decisions to be being made basically by one individual, one office, and decisions that I personally think should be allowed to be made at the local level. And so at some point, I think it is, if it continues, I think it's good to have a conversation, just the legal ramifications of continuing, discontinuing, and the consequences, impacts on our city both ways, of whether continuing to follow the governor's orders, or if we at some point determined that we were going to make those decisions locally.
Any other comments from the council? Okay. Do we have a motion on this item then?
Yes, Mayor, we do. I move to approve the resolution confirming and continuing the mayor's sixth amended declaration of disaster in accordance with Governor Greg Abbott's executive order GA32.
Second.
It's been moved and seconded to continue the mayor's sixth amended declaration of disaster. Any discussion or further questions from the council about the motion? Okay. All of those in favor, please raise your hand. I see 5, so that passes with a 5-0 vote. Item 3B is to consider review and approval of the major medical RFP number 08-20 for fully insured benefit plans and other benefit services beginning coverage year 2021, CY 2021.
That's a calendar year 2021, correct?
Calendar year, thank you.
We have, and which is also the coverage year, so it's an accurate statement. We are, these next two items are considering all of the components of our health insurance and benefits, medical benefits primarily, for our employees and dependents. With that said, I want to hand it over to Mitch Normand, our Director of Human Resources, to present our first batch of services that we're considering, which is everything except for the major medical and pharmacy. Mitch?
Good afternoon, Mayor and Council. Can everyone hear me?
Yes.
All right. I just want to take a quick moment to introduce to you Randy McGraw, who is our healthcare consultant from Hub International. They work with us through the RFP process as well as maintaining compliance with all the regulations specific to benefit plan administration. And I'd also like to introduce Sandy Elliott, if you would just wave, Sandy. She's our benefits manager here at the City of Amarillo, and she is responsible for the daily oversight of the benefits division.
Randy, it's good to meet you. I can't say in person, but at least virtually.
And, sir, yes, sir. And Stephanie, I believe, has the presentation for the fully insured benefit plans and other benefit services. You would bring that up. I'll go through that presentation quickly.
I am bringing it up right now, Mitch. Give it to
All right, thank you.
Well, I'm trying to. Technical difficulties. Here we go.
Oh, crap, our speaker's on.
All right, Mayor and Council. So as Jared stated, as Mr. Miller stated, we marketed an RFP with several benefit products, which included new benefits for the plan year, as well as renewal of some benefits. And these are voluntary voluntary benefits, as well as some new administrative services for the city. That included vision, which we currently have, life insurance, our employee assistance program, which we do currently have, our Section 125 plan administration, which these are flexible spending accounts and health savings account administration, a long-term disability product, COBRA administration, and the Family Medical Leave Administration, Family Medical Leave Act administration. Stephanie, if you go to the next one. Best and final proposals were requested on May 4th of 2020. I do have the note here that if there's an asterisk next to the benefit offering or the service that is new for calendar year 2021, we did have several respondents that provided responses or that bid on certain services, not as many for others, as reflected here. 3 for vision, 1 for life insurance, which is our current incumbent. We had 2 for our EAP program, one of those being our current incumbent. Section 125 plan administration, we had 8 vendors that responded, including our current incumbent, our incumbent. Long-term disability, we had 1 respondent, COBRA 3, and FMLA 2 respondents. So a panel of 5 city staff, including myself, the finance director, benefits manager, IT director, and risk manager, individually scored the best and final offer proposals that were presented to the city. And below are the scoring criteria that were utilized that include, that we scored the proposals on. That included the purchase price and discount points, which were analyzed and prepared by our healthcare consultant, the administrative flexibility, which scored the vendor's ability to respond to our unique needs and address our organization-specific needs. Quality of vendors' goods and services, the reporting capabilities, reputation of the vendor and their goods and services. So we did put in reference calls to other entities that currently utilize those vendors and the vendor's past relationship with the city. So based on the cumulative scores, staff recommends awarding bids for the following benefit offerings and services to the respective carrier and provider. For our vision, that would be the standard insurance company for a 3-year contract, life insurance to our incumbent carrier, the standard for 3 years. EAP, our incumbent carrier, Deer Oaks, is our recommendation for a 2-year contract. Our Section 125 plan administration, ASI, and they're our current flexible spending account administrator. And the new benefit offering, long-term disability, we're recommending the Standard Insurance Company, who's our current life insurance carrier, be awarded for a 3-year term. COBRA administration, we recommend Sterling Health Services and FMLA UMR Incorporated for a 2-year term. So with that being said, do you all have any questions regarding this information or staff's recommendations?
Yes, Mitch, I do. So first of all, is dental included in this particular benefit, or is it going to be part of the major medical?
That will actually be a separate agenda item on a future agenda date.
Okay. And then for the voluntary long-term disability insurance, what is our cost on that annually?
All right. So the cost on the long-term disability, it's contingent on the subscriber's age as well as their salaries. And there are also decisions that would need to be made internally regarding what's titled an elimination period. Those variables have bearing on the rates. Now, I can give you just a sample rate for someone, depending on the elimination period. If we did a 90-day elimination period, and Randy, correct me if I'm wrong, but the elimination period is the time frame between the date of injury or illness and the commencement of the payments. For an employee earning $30,000 a year, if we selected the 90-day elimination period, the benefit, the income replacement is up to 60%. The cost to the employee on a monthly basis would be $5.10. But again, that changes. It's age banded, and it's also salary banded. So the more you make, the higher your premium. Also, the older you are, the higher your premium.
Okay. All right. Thank you.
Yes, ma'am.
So, Mitch, can you clarify what you mean by voluntary? It's not something we automatically provide, but if an employee wants to sign up for it, and then second, is it something that we are required as a municipality to offer?
Okay, so to answer your first question, yes, the voluntary, that means they're not required to sign up for it. Currently, the city does, all employees elect a basic life insurance policy, and the city pays, the employee pays that amount. For 2021, the city is proposing offering a 100% payment of the $10,000 basic life policy for all full-time employees instead of them paying. Any other voluntary supplemental life benefits are paid for by the employee. Long-term disability would be a voluntary benefit as well, where employees are not required to sign up. I'm going to defer to Randy and ask him to clarify if there are any benefit offerings that we're required to make available that we have not been providing to our employees.
And before you answer that, Randy, on just clarification, so the city does not cover any of that cost. The long-term disability portion of the coverage is 100% the burden, the responsibility of the employee?
Yes, that's correct. And I'm Randy McGraw with Hub International, and it's a pleasure to be here. The second part is there are no other benefits that you're required to offer that you don't offer. You're actually not even required to offer, under the Affordable Care Act, you have a requirement to make an offer or pay a penalty, but there are no other stipulations that require you to offer any of the other benefits that you do offer.
And that is $5 a month, and for the long term?
So for the long-term disability, the monthly premium is contingent upon your age. So the older you get, the higher the rate per covered benefit. And also it's tied to your salary. So the more you make, the higher your covered benefit, the greater the cost would be. So the city does currently offer a voluntary short-term disability policy through AFLAC, and some of your employees participate in that. There's no cost to the city. And the long-term disability would protect them for a loss of income up to the age of 65, which I think is a much better option than short-term disability. And that's voluntary too. There's no cost to the city for offering the long-term disability.
Thank you.
Something you can approve or disapprove this for any reason or no reason. Of course, I recommend you always have a reason for doing something. That's all we have on the presentation on this item if you don't have any further questions.
Mitch, can we see that list again while we're thinking about it, please?
Yes.
So the motion would look something like we accept what the RFP process has delivered to us in these proposals and either pass them or deny them. Is that right?
Along with the associated amounts, I would think, so that we know the dollar amount that we're spending.
Okay. Any other questions, council, about these?
No, my question would just be if I am missing that in the agenda, if we have the dollar amounts then associated, the city's obligation for each of those.
No, ma'am, we do not have that in the packet. Actually, we do have it broken down, but it's not in a table, in a tabular format.
Right.
If you can just direct me to that will be fine.
So in the packet for item B, it's going to be pages, the second and third page of that packet. They're labeled as page 1 of 2 and page 2 of 2, but it's a memo to me from Mitch Normand, and it details all of the different coverages and their cost and their associated costs. It's difficult to say the exact spend on them because they do fluctuate based on experience and number of employees taking advantage of the services, but the pricing information is included in there. Thank you, Stephanie. I know that's you. Next page. Oh, no. Yeah. So going down to the next page. There you go. So the memo, the page 1 and 2 of the memo has all the pricing information.
Okay, do y'all need more time to think about it?
I'll call for the question.
We have a motion.
Yes, Mayor. And what I'd like to do is for this particular item is have 2 motions based on the length of the contracts. So I'll start out here. Mayor, I move to approve a 3-year contract for the following benefits. Vision to the Standard Insurance Company, which is fully insured 100% of the premiums to be paid by the employee in the amount of $183,448. Life insurance to the Standard Insurance Company, fully insured 100% of supplemental life insurance premiums paid by the employee in the amount of $24,283, and a $10,000 basic life insurance policy paid by the city for a total cost of $48,779. The Section 125 plan administration awarded to the application corporate doing business as Asflex Limited, and this would go to the Standard Insurance Company for the flexible spending account in the amount of $25,200 in the health savings account in the amount of $9,000. The voluntary long-term disability insurance, the Standard Company, which is fully insured, 100% of the premiums paid by the employee, and COBRA, awarded to Sterling Health Services Incorporated, doing business as Sterling Administration for a total amount of $24,861. That would be the first part of the motion.
Second.
Okay, it's been moved by Councilmember Powell and seconded by Councilmember Hayes that we approve the items as specified. I won't repeat all of that Councilmember Powell just so diligently put into the motion. But with regard to item 3B, any further comments or questions from the council on the motion? Okay, hearing none. All of those in favor, please raise your hand. Great, 5 for it. So that motion passes with the 5-0 vote.
Mayor, I move to approve a 2-year contract for the following benefits, and that would be the Employee Assistance Program, which would go to Deer Oaks Employee Assistance Program Services, LLC, in the amount of $73,260, and the Family and Medical Leave to UMR Incorporated in the amount of $85,835.
Second.
We have a motion from Councilmember Powell and a second from Councilmember Sauer. Any questions or further discussion, council, on the motion? All of those in favor, please raise your hand. Okay, that passes with a 5-0 vote. And moves us to the next item on our agenda, which is item 3C. Mr. City Manager.
Mayor, I'd start by saying how much I appreciate Councilmember Powell for the obvious preparation that she puts in before meetings and the notes she takes during meetings, because that was a challenging motion, and she knows that she always does. So the second half of the medical benefits packages that we need to consider today is the major medical and pharmacy. To present that is Laura Storrs, and then I'll take it over again after that. Laura?
Okay, thank you, Jared. Thank you, Mayor and Council. I am going to share my screen with this presentation. Okay, so this is RFP for medical and pharmacy services. Wanted to start by going quickly over our medical and prescription claims history from fiscal year 2013 through fiscal year 2020, the current year. Wanted to reflect on this table here that on the far right-hand side, the 2020 year-to-date information is just through the month of August 2020. We are closing out the books for September, and so had 11 out of the 12 months of the year accountable for this chart. So the blue bars that go across the screen are the claims history. And we also have down at the bottom the claims amount that we paid in each of those corresponding fiscal years. Oh, I apologize. And then at the bottom, you will notice in 2016, there was a small amount of red that comes across on each of these bars. That is for administrative costs that we paid related to our medical and our prescription claims. Prior to 2016, the city was self-administered, and so therefore there was not the administrative cost that came along with the overall claims cost. The city is self-insured for both of these services, but again, beginning January 1st of 2016, the city outsourced the third-party administration of medical services. And you can see that red amount coming across the bottom here. There's also a green line that you'll notice is trending here on the graph. The green line represents the covered lives on our medical and prescription plan. And again, you will notice there's a pretty significant decrease in the year 2015. And that decrease was related to some plan changes that went into effect January 1st of 2015. And that was to transition all of our Medicare eligible retirees off of the city's the city's health plan and onto Medicare. And so you can see there was a significant drop in 2015, and then our covered lives just began rising again, which we normally see that trend continue to rise year over year. So currently, the city has two carriers, one for medical, one for pharmacy. Aetna is the city's current medical carrier, and Maxer is the city's current pharmacy benefit manager. Both of our current agreements were effective January 1st of 2016 for a 3-year period. Both also came with renewal options for 2 additional 1-year terms. And those renewals were both exercised with both agreements for plan year 2019 and plan year 2020. Because those agreements were coming to an end, the city went out for a request for proposal process, and we marketed this request for proposal on January 20th of 2020, soliciting bids from carriers for the following services. First, we did for third-party administrative services, and that would be related to medical. We also did pharmacy benefit manager services, also referred to as PBM. And we also had an option to bundle the third-party administrative services with a pharmacy benefit manager service. We received best and final proposal responses. We requested those on May 4th of 2020, and we had 4 carriers that proposed a bundled TPA PBM service during our best and final offer presentations that were conducted on May 28th of 2020. 2 carriers proposed standalone PBM services during the best and final offer presentations that also were on May 28th of 2020. So similar to what Mitch mentioned in the last presentation, we did have an evaluation process that was a panel of 5 city staff members, including the HR director, the finance director, the benefits manager, our IT director, and our risk manager. Each one individually scored best and final offers, applying the following criteria. And again, this criteria was developed with assistance from our city healthcare consultant, and it was also based on best practices. So the first item was the purchase price and discounts that were assigned 40 points. And that criteria was analyzed and prepared by our city healthcare consultant, and it was also verified by 2 additional healthcare consulting companies. We had 25 points associated with administrative flexibility, 15 points for the quality of the vendor's goods and services, 10 points for reporting capabilities, 5 points for the reputation of the vendor and their goods and services, and then finally 5 points related to the vendor's past relationship with the city of Amarillo. Now, based on the RFP process, the cumulative scores that came out of the process results in a recommended award for the bid to Aetna Life Insurance Company and CVS Pharmacy for the proposed TPA PBM bundled services that would commence on January 1st, 2021 for 3 calendar years. And I'd like to pass it over to Jared Miller for some additional comments related to this, and also for any questions council may have.
Right. So I want to make some additional comments, and like Laura said, then we can answer questions about Laura's presentation, my comments, or anything else. The RFP process began in January this year. That is a significantly different time from a medical experience, from the type of experience that we are experiencing right now. The process stipulates how the bids are going to take place. It also lays out what we're going to do to evaluate those things, the proposals, and then score those proposals, and then rack and stack those proposals, and then the recommendation that comes out of the process is what goes to council. It is a very long and time-consuming and exhaustive process, and I think you can see by what Laura showed, we use all of the best practices. We also use the very best in consultants to assist us in making in preparing the recommendations, because the process makes the recommendation. What I want to propose to you is a departure. We have the legal right to approve or not approve what's been proposed for any reason or no reason. As I said earlier, if you don't have a reason, why are you doing something? So I want to offer up some thoughts, and then y'all can take action based on what I have to say. Our experience and our expectation of the life insurance, of our medical, of these issues was one way prior to April or May, February or March rather, of this year. But after February and March, really March, everything changed with the advent of coronavirus, and it highlighted for me the need to make sure that our employees are utilizing the very best that we possibly can give them with regard to wellness. As someone who experienced coronavirus, and I can tell you that my experience was catastrophic. It was everything short of going to the hospital, and I can only thank the assistance of the doctor who was helping me at the time for keeping me from having to go to the hospital. And we all know, not that hospitals do a bad job, but when you do go to the hospital, especially when you get on a ventilator, the effects, as Dr. Sauer was talking about earlier, of coronavirus are much more pronounced with regard to all of the comorbidities and the exacerbated effects that those morbidities cause for your long-term recovery from coronavirus. When I say morbidities, I'm talking about things like obesity, heart disease, diabetes, and any type of respiratory ailments. The point here is that for my employees, for our team, and for their dependents, and we represent over 4,000 of our residents here in town. That's over 2% of our residents, just by our plan. We can set an example for our community and for the rest of our employers to focus on wellness. And what I would like to propose is that we not approve this, and that instead we work with our current providers to get an extension, a 1-year extension, which will provide us time to do an RFP, a request for proposal, over the course of the next year, or starting this next year, which will give us an opportunity to design a medical care program that is focused at one of the primary focuses of the plan will be wellness. One of the effects of wellness is that people, one, experience fewer instances of those morbidities that I was talking about, those conditions that I was talking about that dramatically affect their quality of life, the length of their life, and to our taxpayer standpoint, the cost of the healthcare program. When you see that we're trending upward every single year, with a couple of exceptions where it vacillates up or down, almost 22 million in the calendar year, or in this current calendar year, as we're projected, it's a significant spend. If we can do things that reduce our reliance upon medical procedures and their need to go to the hospital to receive services, we can expect our healthcare spend to reduce over time if we become a poster child for making wellness a priority in our plans. We've always had wellness. and that's things like medical checkups and things like that as a component of our plan. But it's been more of an a la carte add to the basket of things that we're getting for health insurance. I'm proposing that we make it a primary component, a full spectrum primary component of our medical plan. So to that end, and it will require us to work with Aetna and with Maxor and to make this work out for us. But I think it provides us the best opportunity to take care of our team and all of their dependents in the very short term, and to be able to reduce our spend and have better health outcomes for our team in the long term. So does anybody have any questions for me? We have reviewed this with legal. We do have the authority to select the recommendation that came out of the process right now. We also concurrently have the authority to not accept or to decline the recommendation that's been put in front of us today. That would provide us the opportunity to then go forward and design a plan that is focused on wellness. As I said, if we had our crystal ball, we would have done this in January of this year. But we didn't really have that global pandemic to be the kick the kick to start us thinking about this as a focus for our healthcare plan in January. So I regret that we're doing this, at the very last minute, but I would rather take steps now to safeguard our team and their dependents, and to take an effort to reduce our healthcare spend in the long term over time right now than to wait 3 or 5 years from now to do it. So with that said, I can answer any questions that council has. You have a couple of different directions that you have the authority to go. And we want to make sure that you're making decisions based on the best interests of our team and our community. And I want to answer any questions you have.
So Jared, can I make a couple of statements based on all of that? So I know that I called you earlier today asking you about several different things, and this was one of them. And I'm very, very interested that as a city that we would consider a wellness program, a well-defined wellness program. There's a lot of information out there that basically says that it has a humongous impact on not only on the lives of those who are covered, but it actually on the bottom line that the city's having to pay as far as insurance costs. Like one of them is they based it upon those people who exercised, and the criteria was exercising more than 150 minutes a week, from 0 to 150 minutes, and then for no exercise at all. So here's what I want to do with the 150 minutes is just consider this. It is 5 days a week, working out for 30 minutes a day. And even that could just be walking. And if you're a speed walker and you can do 15 minutes a mile walking, which is an incredibly fast pace, that's 2 miles. So that's basically just walking 2 miles a day, 5 days a week. This is what the result is. They spend about $4,500 a year on healthcare costs. From 0 to 150 minutes of exercise a week, they spend $5,076. And if there's no exercise at all, it's $5,813 a year. So very quickly, a wellness program can translate into $1,800 a year in healthcare costs that are saved by just doing something simply like that. Another thing is there's another study out there that determined that 11.1% of total healthcare costs in the U.S. was directly related to inadequate physical activity. And the U.S. spent $3 trillion in healthcare last year. So 11.1% of that is $333 billion. And so these are the kind of effects that just simple, a really well-planned out health wellness program that's added to it, the cost benefit for the city is so outstanding that I think that needs to become an integral part going forward. And so I'm very interested in us doing whatever it takes for us to have a wellness program as a part of this, because I know that it will be in the best interest of the city employees families, and the city itself as the spend that we'll be making for healthcare. It's a no-brainer, I think, at this point.
Well, I want to be clear. It's difficult to quantify or articulate exactly, how we're going to work out as far as our long-term spend on health insurance once we make wellness a primary service that we're providing, a primary benefit we're providing. The reason for that is healthcare costs are escalating dramatically. And our employee mix is going to change every year. Sometimes we're going to have employees that have morbidities or issues in a mix that's different from a previous year or a future year. So there are a lot of variables moving around as we talk about this. I think it's logical to assume, though, that the healthier people are, the less they will be taking advantage of services and the healthier they will be. And the less frequently they're going to need to go for things like heart stents and diabetes medication and all of the different things that we as a culture have at a very high rate. An example, though, of some of the potential savings that we can expect. In a previous city, we put in just one component, and I'm talking about a full spectrum of programs. They all have their benefits, but we put in one component that was a nutrition plan. Some could say it was a diet, but it was really a full service, counseling. Here's the reason behind the way we eat. Here's the way to be able to make it work for you. Because a lot of people just don't have the discipline to not have the sugar, which, for anybody that has cancer, they know that that's basically poison, says the guy who really loves sugar. But we did a nutrition plan with our employees. We had 40 people that took advantage of it in a staffing pool of 550. One person was very diligent, didn't do anything extreme, but made changes to his dietary lifestyle that resulted in significant loss of weight because there was obesity there. There was also diabetes and some other morbidities involved there. That it was roughly $30,000 that the city spent for that program. That one employee was, at the start of the program, receiving almost $30,000 of benefits from prescriptions and medical services a month. Almost all of it went away as a result of it. Now, they were going to continue to go to the doctor and see things, but the medications that they were receiving were very expensive, and I'm sure they might be less expensive now, possibly even generic. But I know that the savings of that one person, and there were others that had significant savings as well, justified not only that program, but paid for not only that program, but a lot of other programs. We can expect to see similar results. I can't promise, any one instance is going to have that same benefit, but I can guarantee you that employee, if they stick with it, and if they maintain a focus on their health condition and are aware as things crop up, continuing to go for checkups, that they're going to live longer and healthier. I want that for every single one of our teammates and their dependents. So this is an important, I truly believe this is an important component going forward. I do wish that we had made it a focus previously, but I can guarantee you that going through coronavirus and seeing some of our team and our community going through coronavirus, definitely seeing the number of fatalities, the mortality rate that we've had here has made it more real for me and something that I really want to focus on going forward. Obviously, that's just a recommendation for council, and I know that everyone's going to have a different opinion or a slightly different opinion from me, but I think this is a way forward that has a significant upside for our community and can definitely set an example for our commercial partners throughout the city that would affect more residents were they to take up that same approach.
Other thoughts or questions, council? Elaine?
Well, I totally support switching to a wellness-focused type of life insurance cover, or medical insurance coverage. That makes a ton of sense. We've talked about it in the past. I think that was even one of the first years possibly on the council that we've been talking around the edges around that as well. So I absolutely support shifting to that type of a focus. and lowering the demand for medical services, working on that end, as opposed to just trying to cap prices and premiums, which we have much less control over. So my questions are, we went through a full RFP process on a product we no longer want, is what I'm hearing. And so we are
not focused exactly in the direction that we want to go. We want health insurance and medical services. We want to. I would propose that we modify it to give us exactly what we need that's going to best serve our employees in our community. I don't want to say we don't want it, but we need it to perform differently than what we've historically done. I'm sorry to interrupt. I just wanted to.
So then that becomes, so when we're talking about a 1-year extension, are we extending with product A or with product B that is wellness focused?
We would be extending with our current product, which would be a 1-year forward with our current product, but allow us the time to do the request for proposals that would be focused entirely in the direction that we want to go and would best serve us in the long term. It's either that or go with 3 to 5 years of our current mindset forward. Now, we would work with that to add more wellness programs to what we have, but the plan's not designed around it. And I truly believe that Aetna, they've been a long-term partner with us, as has Maxor, a very long-term partner. I think they'll work with us to get this 1-year extension done so that we can then focus on a wellness-based medical program that addresses all of these concerns. So it would be 1 year going forward with our existing plan, exactly as it currently is.
Okay.
There might be a minor adjustment in price because they're, as costs for everything go up, there might be a 1-year period where we have a slightly increased price, but I don't think it would be significant or egregious, and I think they'll work with us.
And contracts are not done typically 1 year. You're discussing an extension, but the other proposal was for 3 years.
Correct, with 2 1-year extensions available.
I just want to be sure that our 1-year extension is not at a higher price than what was bid for a 3-year contract for the same product.
It will not be higher than the 3-year contract. It will be higher than 1 year of that 3-year contract, if that makes sense. It will be roughly at the same cost that we're currently paying. Our next 3-year contract would have realized some savings each year, but the 3-year contract is much higher than what we would pay in 1 year.
No, I was talking 1 year to 1 year.
Okay. Yeah, it'll be a little bit more expensive than what we would pay in year 1 of the new contract, of this proposed contract. But what we get for that is, 1, a tailored plan that does exactly what we want, and the opportunity to save money over time by experiencing better health outcomes through employees that are more focused on wellness.
And a new RFP would go out that targets the wellness program. The 1 year is not an automatic into the other. They are not the only firms that are in that process.
So the RFP would go out to all, third-party administrators out in the market. They would build that plan based upon the criteria that we put in the request for proposals. They would bring on whatever partners are appropriate that are going to provide the services that they have in their current plan or in their current proposal, as well as enhancements to the wellness side of things that they would need to bring on. And they may have all of those components internally already. They may already have agreements with companies that provide those services that we're asking for enhancements to, all the different myriad of wellness program services that we're talking about. But they may not. So it would be up to them to either leverage the relationships and arrangements that they currently have within their own provider pool to be able to provide the services that we're asking for, or they would have to create those relationships in order to be a competitive bidder. But we would not be only limiting ourselves to our current, the people that have submitted bids right here, nor would be eliminating any of the people any of the good companies that have submitted proposals to this program.
So has CVS also submitted a proposal for a 1-year contract?
No. CVS submitted, they were a component of the packaged health insurance and TPA, third-party administrator, and PBM, prescription benefits manager proposal. They were the PBM side of that combo proposal that we're looking at right now. They also submitted a pharmacy-only proposal. But both of those proposals were 3-year proposals for a 3-year contract with 2 1-year extensions included. They did not submit anything for a 1-year deal. And for 1-year deals, what we would be looking at is extensions with our current providers.
And Jared, is that partly because in order to change what we have to go through an RFP process?
Yes, ma'am.
Because what we want is for every company who's interested in having a chance for that business to have a chance. We want the process to be fair and for them to have a chance to put forward a bid. So if we change, we can extend our existing situation. But if we change, then we need to go back through a process that's fair to people who haven't been perhaps providing that service to us. And I think that's part of where I get confused on the RFP process. But I think that relates directly to what Elaine's asking, which is we can't change the type of product we're getting without going through an RFP process.
Correct.
Elaine, is that your question? Yeah, there you go. Now you're off.
I am concerned on what the price discrepancy is. It may not even be that there's even an option for a 1-year from someone else, but the difference in cost, I think, is something that is part of the conversation.
Right. There is not an option for a 1-year to negotiate a 1-year contract with any of our proposers as a function of the RFP process, because the RFP process stipulates exactly what we're asking for. And once we go through the process, our options are either to take it or to not take it. With regard to our existing contracts, we do have the authority and the option to extend that contract for a 1-year term. And that is as all contracts, that is a agreement between 2 parties. So it would require consent from and partnership from those companies that we would be seeking a 1-year extension that would allow us the opportunity to focus the medical program on wellness-based, a results-based, wellness-focused medical care program rather than a symptoms-based, treat the symptom, which is how we're currently, focused. We do have, and as I said, I don't want to sell anybody short. We do have wellness components inside, but we are not wellness-focused.
So, Jared, what I hear you saying is for us to shift to this wellness focus, we only have one option in the interim.
Yes, ma'am. Well, and I would say 2. We could go forward with our current proposals, which do have savings over our current year plan, year over year, and then add more wellness components, which will drive up the cost of that proposal. So it won't look exactly like what the RFP is, and it will be built kind of in a hobgoblin kind of way.
Right.
Or at least in a piecemeal kind of way.
To shift in a faster process to the wellness directed, then we cannot enter into a 3-year contract and we can only extend our current 1 year. Otherwise, we push back this approach of a wellness approach for 3 more years.
Yes, ma'am. Well, and a wellness-focused design program, yes, that's correct. Can I get, Stephanie, can you throw up, or Laura, can you throw up the slide that talks about, that shows the bar graphs and the cost of healthcare? Now, I don't want to downplay the cost of medical administrative services. But what we're talking about, the slice where we're going to have a slightly more expensive pay next year than what we would have if we took the 3-year deal that's in front of us right now, it lives inside that red part at the very bottom of the far right column. You can see over the last 5 years, we've been driving down the cost of administrative services every single year. My goal and my objective is that through our efforts with wellness, the place where we're going to have the bigger impact is in the blue bar. That's the vast majority of our healthcare spend is actual service, cost of services, not the cost of administration. So we will have a slightly higher spend on a very small percentage of what we spend in the administrative section next year. The opportunity, especially in the mid and long terms, is to have a significantly reduced healthcare spend overall and more healthy employees to boot. And I would say probably that's not the one to boot. I would say that's right there with a reduced spend is a healthier workforce and their dependents. So I think this is very illustrates very well the objectives that I have. Yes, we will increase the spend on the very small percentage that we spend on administration for 1 year. But the carrot at the end of that work is that over time, we're going to reduce the spend on the claims side through having a healthier workforce. So it's a financial thing. It's a quality of life thing. I think it's worth taking moving in this direction. I've offered way too much opinion there, so y'all take it for what it's worth.
Elaine, I couldn't agree more with what your very opening comment on this was. We don't control the cost of seeing a doctor, but we, by our choices, do control how many times we need to see a doctor. And I think if we're going to get control of this item, this is a big item in our budget. I support the shift because of exactly what you said. We're never going to be in control of how much a doctor charges us to come and see him. But we can control, with more control than maybe we've had in the past, how many times we need to see a doctor.
So, Mayor, I'd kind of like to tie 2 or 3 topics we've had today. First off, on this item, I am in support of shifting to a wellness, not committing to a 3-year contract and extending the 1-year contracts with the groups that we have now and having an opportunity for an RFP through this year. So I'm going to lead with that, give the quick summary on that, but just open a conversation in, several things we've talked about today. When we're talking about comorbidities and underlying health conditions related to the pandemic we're dealing with. And one of the issues that research early on, even in March and then April, was showing a significant tie to obesity. And, 2 key factors were age and obesity. And through the pandemic, the surveys and studies have continued to show that connection. I recently, even this week, those reports have surfaced again. And I think as the president contracted the virus and dealing with his age and his weight, it became a major focal talking point. And so there is absolutely a connection to increased health problems and underlying conditions, specifically with COVID-19 and with weight. And as we're looking at proactive things as a community to try and have a healthier community, this is, I think, another layer we could be adding. We've used the Swiss cheese analogy of how to add layers. Another layer is health, wellness, to be stronger if you are contracting the virus. And so then we talked about trails and the need to be outside exercising and possibly the ability to be pursuing grants. I just think all of these things are tied together. And we as a city to be setting an example towards focusing on wellness, the exercise that Eddie pointed out, the breaks in those areas, the tremendous benefits from those. And so in many areas, and so I think all of these tie together. If there is an opportunity for us to pursue CARES dollars related to wellness, health, that could be applied to our parks possibly. I think it is a very legitimate argument that a healthier community is less susceptible to spread of the virus and possibly another avenue for us to pursue some dollars.
Agreed.
I think that's
I should also say that to Councilmember Hayes' point earlier, she did speak to me about, isn't this something we should look into doing more of? And I concurred, but we didn't do it initially. But she's absolutely right there. This is one of those things where it's like we've seen a number of things with the police department where we have a task force focused on domestic violence or violent crime or other things. We have those. When you put that task force in place, you find the thing that you're looking for, and they do a good job of it. But what it appears on paper is that task force created more domestic violence or violent crime. They're just doing a better job of prosecuting it, and we see it because they're out there looking for it. That's going to be the effect that we have when we go into wellness. We're going to start being more working with our team more to let them know about their current health conditions and things they can do to improve it. So the appearance is going to be that we're less healthy than we were before. But what's actually happening is we're aware of the challenges we have from a health state, therefore empowered and informed to be able to address those with a health plan that's designed to address the things that we find through wellness checks. So while we have a temporary increase in the incidence of claims because we found these conditions, long term we're going to spend less because we're not having to deal with the consequences of going a long time without addressing them. Because as we all know, you go longer with a heart condition or with any other condition, the consequences are much more extreme down the road than treating it now. So that's the goal. Mayor, I kind of stepped in on you when I was...
No, it's all right. It's good. Anybody else have thoughts on this? Rita, Howard? I haven't heard from you guys.
I'll offer up my thoughts when I craft the motion.
Okay.
You might defer to Howard in case he has any.
Howard, you're muted.
Hey, Howard, can you turn your microphone on for us?
How long does it take to go through the RFP process?
It'll be similar, I'm sure, to what we've had this year. We will start in January, and we'll expedite as quickly as possible. And I would anticipate we'll be done by June. That'll be the goal.
I'm all in favor of going the route of the wellness plan.
Sorry, I didn't realize my camera was off. I was speaking to you disembodied.
Okay. Well, then, do we have a motion on this item?
Yes, Mayor, we do. So as I'm sitting here trying to craft my thoughts in this motion, so it gets to be challenging, especially on the spot. So in light of coronavirus and the impacts that we have all experienced over the past 7 months, and because I personally like the idea of making wellness a primary component of our medical plan, which I truly believe will see our employees and our dependents healthier, and it's going to save our citizens money over time, I move that we decline and not approve the bundled option major medical request for proposal for medical and pharmacy.
Second.
This will to work. That's okay. This will allow us to work with Aetna on a 1-year extension of our current medical plan for the calendar year 2021 so that we can design a request for proposal process that will include a full spectrum of wellness services as a primary component. Those are my thoughts in motion.
Okay, so can I second now?
Yes, sir.
Okay.
Okay, so we have a motion from Councilmember Powell and a second from Councilmember Sauer. Any feedback or questions on the motion from the rest of the council?
Do we need to address the second part of that contract that was the pharmaceutical, Maxor and CVS? Because I don't think that that was included in the motion just relating Aetna.
No, it's Maxor and Aetna. It's pharmacy and medical. So
yeah, I combined.
Declining the bundle that's in front of you right now. So it would decline it all.
Yeah.
Okay, but I'm glad you asked, Elaine, because it's a technical motion. We need to make sure all the components are in there.
Yeah. Yeah, so Mayor, I did.
Not bundled, are we? Is Aetna bundled with Maxor? Because that would be a different.
No, they historically this would have been the first time that we ever did in the history of Amarillo a bundled medical and pharmacy healthcare plan. We had never done that before. We have historically always done those as separate proposals, selected separately.
Okay, so I'm not hearing any further questions or discussion from the council. All of those in favor of the motion, please raise your hand. Okay, all of those opposed to the motion? I think I saw 5 in support, but I had a little glitch on my end. My computer screen froze for a second. So I don't see anyone opposed. Can you just show me if you were for the motion again one more time? Okay, I see 5 hands for it. Thank you. That's a 5-0 vote in support of the motion. So, Mr. City Manager, I think you have what you need there in order to move forward and take that different approach. And we appreciate your leadership in that. It's doing it differently than we've ever done it before, but I think we'll be better for it in the long run.
So we'll be working aggressively with our current partners at this point to get a way forward so that we can make sure we're taken care of next year at the same time as performing the RFP to make what I think is a pretty significant sea change in how we do healthcare for our employees and dependents.
So, Mr. City Manager, on a possible addition to a future agenda, could we include updates from our Parks and Rec department on any possible federal funding that could possibly be applied, and consideration through our health department of including public service announcements and information towards wellness, specifically directed towards weight and the connectedness of just the developing number of health problems, including heart disease and diabetes related to COVID-19 complications?
Yes, ma'am. We'll get a multi-department task force on that, and it is associated with what we're talking about because it tries to expand healthy living, responsible wellness choices, not just in our organization, but citywide. So we'll put that together. We'll definitely communicate with you directly to make sure that we're tailoring this in the direction that you're thinking, and that we're not misunderstanding anything. And then we'll also communicate with the rest of the council when we get this campaign ready. But I'm thinking parks, communications, human resources, and any other stakeholder departments that come to mind as we go forward.
Thank you very much.
Yeah. Okay. Item 3D is to discuss and consider approval for a restated lease between the Amarillo Economic Development Corporation and MWI Veterinary Supply Company. Mr. City Manager.
All right, Mayor, this is something that we've discussed in executive session, and now it's coming to fruition. So the next 2 items, for this item, I'm going to throw it over to Kevin Carter, President and CEO of the Amarillo Economic Development Corporation. Then I'll make a couple more comments before we throw the next item to him as well. Kevin, take it away.
All right. Thank you, Jared. Mayor, City Council, have for you today to present an expansion project that we've been working on for about 15 or 16 months. One of the first projects that Michael Kitten started working on when we revived our business retention and expansion program. So very proud to finally get this one brought here for your approval. This is MWI Veterinary Supply Company. They are a subsidiary of AmerisourceBergen, a Fortune 25 company. They are looking to expand their existing Amarillo footprint. They currently operate in a 69,000 square foot AEDC owned facility in the Centerport Business Park. This agreement would allow for the expansion of that existing building and construction of a new building to go along with that. Highlights of that construction project are 6,000 square foot in the new building to be built at the northeast corner of that property, and then a 5,000 square foot mezzanine to be built in the current building. About $1,040,000 in construction cost. We would assume that cost with a 2% interest rate and amortize that over 15 years. The new lease would be for 10 years with 2 additional 5-year renewal options. The new lease payment would be $42,886.57 per month. Currently, that lease payment is $36,194.08. The AEDC board approved that restated lease on September 20th, 2020 with a 5-0 vote. Would be happy to answer any questions, Mayor, Council.
Questions, anybody for Kevin about the project? We have discussed this one in executive session, and so I know sometimes it makes it seem like to citizens who might be watching that, well, this, we didn't have questions about this, but this is something that, because it is a contract and it relates to economic development, we have previously discussed it as a council. And Kevin's done a good job of laying out the high points of the deal here today.
And in this next item, Mayor, then we're going to talk about why they need that expansion. So it's a great deal why they need the expansion. So,
Mayor, do you want to vote on this item first?
Yes, I do. If you don't, now would be a good time for a motion if anyone wants to make one.
Yes, Mayor. I move to approve the reinstated lease between Amarillo Economic Development Corporation and MWI Veterinary Supply Company, which would be the lease payment amount would be $42,886.57 per month for 10 years minimum with 2 additional optional renewal periods.
Do we have a second? Okay, it's been moved by Councilmember Powell, seconded by Councilmember Sauer to approve this new agreement between the AEDC and MWI Veterinary Supply Company. Are there any other questions or more discussion from the council, especially considering the motion? Okay, hearing none, all of those in favor of the motion, please raise your hand. Okay, I see 5, so that motion passes with the 5-0 vote. Next item, 3E, go right back to Kevin on that.
Yes, Mayor, and I do want to apologize. I didn't mention it before that Tim Peart, who is president of MWI, sends his apologies for not being able to make the council meeting today. He had emergency travel that he had to do, and so he did want to send his regrets that he wasn't able to be here. So, but we're very thankful for the local leadership that we have here with MWI. The second item that we bring up, MWI Veterinary Supply currently operates in that 69,000 square foot space that they have, and will expand to the 80,000 square foot with the restated lease improvements that council just approved. MWI is currently under a location incentive agreement with AEDC dated May 22nd, 2014, that's based on 120 employees and $6.7 million in payroll, that pays a rebate of $160,000 annually over 10 years on a 1.6 renovation building that we did back in 2014. With this new and second location incentive agreement, they are going to expand their footprint employee-wise, not only in space, but also add employees. The highlights of the new second location incentive agreement will provide up to 50 additional employees at $65,000 annual wage or a $3.25 million new payroll projection. They're currently at 132 employees, so they're hoping to add up to 50 additional employees. That total job incentive will pay $15,000 per employee over a 10-year period, or $750,000 maximum over that 10-year period as they perform. This incentive fits within the parameters of the comprehensive incentive guidelines that council approved last year. And so we're very happy that they want to expand in our community and add 50 additional jobs. These are well-paying jobs, well above our lowest amount on our matrix. They're right in the middle, upper middle of that matrix, and so that warrants the $15,000 per job. Based on the level of additional full-time jobs created and the projected payroll, the AEDC Board of Directors approved that second LIA on September 20th, 2020 with a 5-0 vote.
Council, do we have any questions for Kevin about this next part of the MWI deal? Surely one of us is going to comment on the salaries. Very impressive.
Yeah, they pay really well out there, and we're very, like I said, very happy to have them in our community.
Yeah, I would just say I think this is exactly what the business retention component of the AEDC is supposed to do. So, Michael, I want to, on behalf of the council, just to pat you on the back and say thank you. This is what supporting the local business looks like, and this is definitely one we want to stay in Amarillo.
Thank you, Mayor.
And I can give you a few just some of the economic impact numbers with those 50 jobs over a 20-year period. It's going to increase our wage $76 million. That's $76 million just paid in those direct jobs. Those 50 new jobs. $59 million in additional spin-off jobs for $136 million payroll over 20 years. So you can, average that out. That's about $6.5 million a year annually. And then that equates to about $25 million in new taxable purchases over that 20-year period. So about $1.25 million per year in new taxable sales to our local businesses, which is impressive.
Yeah, that is impressive.
Mayor, I want to follow up on your comment about business retention. And I believe it was 2 years ago that the Chamber hosted an analyst with the Federal Reserve Board out of Dallas, and analyzing different cities across Texas and their growth and population and economic expansion. And a major point I took away from that presentation was that for cities our size and that 200,000 size population, that the majority of our economic growth would come from business retention, expanding the businesses that were already here and creating additional opportunities. And so this does fit right in there. That is, we love those opportunities. We love when we bring an outside business in, but that the market, especially for our size of our community and our location, that this is one of the best resources for economic growth in our community. So congratulations on closing this deal.
Thank you, ma'am.
Okay. My screen back. Okay, so I think we need to vote, right? We've got a motion. We need to take a vote. So we're ready to call the question then. I can't see everybody. For some reason, my screen's done something weird.
So, Mayor, I need to offer up a motion.
Okay, thank you, Frida, while I'm messing with my technology issues here.
I move to approve the location incentive agreement between the Amarillo Economic Development Corporation and MWI Veterinary Supply Company.
Second.
It's been moved by Councilmember Powell and seconded by Councilmember Hayes to approve this location incentive agreement Any further discussion from the council about the motion? Hearing none, all in favor, please raise your hand. Okay, I see 5, and that motion will pass then. Thank you to the AEDC team for joining us today and bringing those 2 items. That brings us to the end of our agenda for non-executive session. We do have 1 item on executive session, and so at this time we'll adjourn if our city attorney will read our special language, please.
Glad to pursuant to the Texas Open Meetings Act, closed session of the Amarillo City Council was announced on October 13th, 2020 at 4:50 p.m. under the following authority. Section 551.072, discuss, purchase, exchange, lease, sale, or value of real property. A public discussion of such would not be in the best interest of the city's bargaining position. Thank you.
Thank you all. See you in that next meeting.